So can I ask everyone to take a seat? Yes. We still have colleagues trying to enter security, but before we even start, we'd like to congratulate you for making it inside. And for those who are, let's say, in the outer banks, there are still free seats around the table. So all the speakers are sat, so feel free to step up to the big round table, as we would like to have this as a conversation. And the easier it is to see one another, the easier it will be for discussion. So I'm Frédéric Destrebecq. I'm the Executive Director of the European Brain Council, and I'm really pleased to hand over for the introduction to our host of today, MEP Aurelijus Veryga, whom we would like to thank already for his support and his hosting today.
Okay, thank you. Thank you very much, and hello to everyone. And welcome to the Brussels, even if it's not very easy to enter in, but you are very smart people, and finally you made it. And I'm happy to see such a big group of colleagues. Why I'm telling colleagues? Because my profession was a psychiatrist. I was a medical doctor. And 9 years ago, I was still practicing in the field of addictions. So the brain health is very close to my heart. And I'm happy to host this event and see all of you coming here to talk about this very important issue. And just a few things that I would like, maybe to say for the introduction. I was wondering what could be told, just to enter this very broad topic. And few things came into my mind. And first is that we are all now and today facing new global challenges. And most of them are affecting brain health, mental health. And I will just give you three examples, three very concrete examples. First, you all definitely remember and know the COVID pandemic. This hit very hard and especially it affected everyone, but it very much affected young people, children who had problems with their socialization because they were isolated. I had children at that time that were attending school, and I remember all the steps they went through. At the beginning, they were missing friends very much. They wanted to come back. But after the year and a half, it was very, very hard for them to come back. And you see, how it affects heavily their mental health status, how it becomes complicated, to associate with the friends, to chat with them, to go for live meetings. So this was one hit. Then unimaginable scale war conflict shakes Europe. And again, with millions affected. Many of them will have PTSDs. Some of them will have the direct brain damage because of injuries. So this sooner or later will become a very, very big challenge for the Europe, because people will have to deal somehow with that. For the moment, when people are mobilized to fight for the freedom, they don't think about the PTSDs and other things, but after all, it will come up. Then the third thing I would like to mention, a few weeks ago, the OSCE Parliamentary Assembly Special Representative Dr. Gudrun Kugler presented a report on demographic change in OSCE region. So among other social, economic, security challenges related to demographic winter, she mentioned epidemic of loneliness. And research clearly demonstrates loneliness being associated with increased risk of anxiety, depression, suicide, sleep disturbances, dementia, and stroke, and many other problems. So we are all facing already that challenge, and we don't know yet how to deal with that, because especially the older generation will feel that very heavily. And there is a temptation, to solve that, I think, in a very wrong way, by helping them to die earlier, assisting them to die. I think it's a very wrong pathway. I think we have to help them, not to die, but to live the normal life. And we are still facing long-lasting problems related to substance use, starting even before birth, when problems like fetal alcohol spectrum disorders appear, then going to teenagers, problems caused by legal and illegal substance use, a new trend with excessive use of e-cigarettes, and at least in my own country, illegal drugs are sold through this way by putting the psychoactive substance into vaping liquids and sold to teenagers in the schools. You have also faced the challenges with medical shortages, and the Commission is going to present the Critical Medicines Act. And I'm sure it's very important to this community and to your patients also, because some of them still have no access, not just to generics because of the production and supply problems, but also to innovatives that are not affordable for some member states because they are too expensive. And my willingness and my wish as a member of European Parliament will be to work and push the Commission to do everything needed that those innovatives would become available to every patient in every single member state in the European Union. So having in mind this complexity, it would be very good to have national brain plans at least, and have the EU motivated to solve these problems, because there are many, many of them. And I'm very happy that you came here today to talk about that. And later on, I'm very sure you will push the politicians to make the right decisions. So thank you for coming, and have a very good day today.
Next, we have Professor Claudio Bassetti as Vice President of the European Brain Council.
Dear Minister Veryga, dear speakers, ladies and gentlemen, warm welcome on my behalf. I am the Vice President EBC and past President of EAN and Chair of a national plan. So I have three hats today, which actually justify why I'm addressing a few words. So welcome to you all. 2022 has been a memorable year. As you know, unfortunately, the start of a new war in this continent. But also on a positive note, a memorable year for neurological disorders. This is the year when the white paper of the WHO on brain health was published. And it was during that same year in May 2022 that the WHO Assembly in May adopted the Intersectoral Global Action Plan on epilepsy and neurological disorders. For the first time, neurological disorders were seen as a public health priority worldwide. Now, 3 years later, it's maybe the right moment to start looking at what the different stakeholders at national, European, but also world level have been doing in joining forces to face the challenge that Minister Veryga has been describing to all of us. I think it's very important that we develop an holistic approach to brain disorders, neurological and psychiatric disorders, as you pointed out, that we have an approach which includes all the important stakeholders in the health profession, but also beyond, political stakeholders, pharmaceutical companies, policymakers, politics, patients, patient representatives, the entire population. And I think we have to learn to work together better than we did in the past to join forces. The resources are limited, and you pointed out also to the major challenge of having limited workforce in the field to address these topics. And this is one more reason to really join forces. And joining forces means also that we learn from each other. I think when at the EBC board, we decided to put together this program. The basic idea is really to profit of what has been going on in Europe. And I would like to say that our Norwegian colleagues have started the entire effort in 2018, launching their brain plan, but many other countries followed. But there are many other countries outside Europe. Some of them develop brain plans, some of them develop approaches to address the topic. And I think the main goal, as I see it today, is really to learn from each other, exchange experiences, and in the end, work together so that we avoid as much as possible mistakes and we accelerate the process, because the challenge is actually there and it's going to increase. My wish is that we will go back from this summit with some messages to our local, regional, and also national colleagues and stakeholders. I would like to end in announcing the first contribution to this summit. Unfortunately, Dr. Tarun Dua, the head of the Brain Health Unit at the World Health Organization in Geneva, could not join us. We are with the WHO in these difficult days where they have to challenge also new issues besides those that they are facing already on an everyday basis. And I'm happy, however, that Tarun has prepared a contribution that will be now projected. So may I ask for the launch of the video, please.
Greetings from the World Health Organization. My name is Tarun Dua, and I'm going to talk about the WHO Action Plan on Neurological Disorders and what's happening around brain health plans across the world. Let me start with first, what is brain health? It is a state of brain functioning across multiple domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. It exists on a continuum that can be considered to range from well-being to disorders and disability. And this is something that as WHO, we published in the position paper, which is on optimizing brain health across the life course. Optimization is important because it improves the outcomes in brain health across the life course, lower incidence of neurological conditions, lower incidence of certain physical and mental health conditions, for example, NCD and substance use. One question that often comes up, what's the interlinkage of brain health and mental health? And I would say that brain health is a determinant of mental health across the life course. When we think about many of these risk factors, such as air pollution, social adversities that impact mental health, they are likely mediated through changes in brain structure and or function. Now, coming on to, as I said, brain health is very much linked to neurological disorders. And let's start with what's the burden. In terms of disability-adjusted life years, they are the leading cause. In terms of death, they're the second leading cause of death. And majority of this burden is in low and middle income countries. At one hand, where you have high burden, on the other hand, there are lack of resources and gaps. In terms of some of the challenges that we see, it is in terms of stigmatization and discrimination, poor access to services and support such as medicines, poor access to a specialist. And this is, for example, if we think in terms of neurological workforce, if it is 7 per 100,000 population in high-income countries, it is only 1 per million in lower income countries. And the impact on lives is severe. These are some of the testimonies from people with lived experience. A person with lived experience of epilepsy. As a child, I had seizures very often, sometimes many in the same day. With access to tests, treatment, and a neurologist, I was seizure-free by the age of 18. Another testimony, again, from a person living with epilepsy. In my community, people believed that epilepsy was contagious. No one wanted to hold my hand. Because of misconceptions, many children with epilepsy don't receive support and affection and miss out on basic human contact. Now imagine a world in which brain health is valued, promoted, and protected across the life course. Neurological disorders are prevented, diagnosed, and treated, and premature mortality and morbidity are avoided. And people affected by neurological disorders and their carers attain the highest possible level of health with equal rights, opportunities, respect, and autonomy. This is the opportunity that Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, that is IGAP, has given us. As you are very well aware, it has 5 strategic objectives with 10 global targets, and the first one is around prioritization and governance, and this is what we are going to focus on. It comes up with actions for member states, WHO Secretariat, international and national partners. Other linked strategic objectives are related to diagnosis, treatment, and care, promotion and prevention, research, innovation, and information systems, and public health approach to epilepsy. Let me start with something that is very much relevant to Europe, and this is from our WHO Euro office, the Pan-European Mental Health Coalition. It's a support mechanism for implementation of WHO European Framework for Action on Mental Health, acknowledging needs for more diverse stakeholders around the table. It is a structure for exchange between different members. It serves as a platform for peer learning and networking, and it allows coordination of advocacy efforts amongst coalition members. While not directly linked to neurology, I think this is an important mechanism and also actually an important example or something relevant that we can think from the aspect of neurological conditions. Another example that I wanted to mention about IGAP implementation in Moldova that has been supported by European Academy of Neurology was in terms of how, as together, we can influence change and lead forward the implementation of IGAP. So a multi-stakeholder workshop was organized, convening healthcare providers, researchers, NGOs, policymakers, and people with lived experience, led to stakeholder sensitization, identifying gaps, challenges, and mapping priority actions to inform IGAP implementation in Moldova. And this is what they are working on in the country now, having a policy brief, and also this will support regional knowledge exchange and best practice sharing. Coming on to the question that very often comes up, how do you mainstream brain health in policy? While in Europe, one would think about standalone plans, especially in high-income countries, because they can be focused on brain health and neurology. They're beneficial in emphasizing brain health as a key governmental priority and securing dedicated resources. But it is important that these are aligned with existing NCD, mental health policies, and other relevant plans. In many low and middle income countries, and especially across other parts of the world, but also in Europe, integrated plans are also an important platform. There are existing opportunities through mental health or through aging or through NCDs, maternal child health. And these can help in having an integrated approach and efficient use of resources, which are often limited across many parts of the world. Some examples of standalone national plans, and you will hear more about it. I won't go into the detail. We are all aware of Norway, and also with the update they are going to come out with. There are also many good initiatives, civil society-led initiatives, for example, in Switzerland, Italy, Germany, Poland. We also are aware of the ministry's initiative in Uruguay, which is outside Europe. And I think there is no one size fit all, but these are all very different examples on how a ministry-led or a civil society-led plans, they can be helpful. And we need to see what works in each of the countries. Some examples of integrated national plans, and here I bring from other parts of the world, like in South Africa, where they're working together with the NCDs, in Kenya or Zambia. So there are many examples that we can look at depending on what resources exist, how the government is prioritizing, and what is the best way in moving the agenda forward. As WHO, we have come out with an implementation toolkit to support IGAP's implementation. It gives a framework, including how to do the situation analysis, the stakeholder engagement, monitoring and evaluation, and looking at all the strategic objectives, has different tools and resources, and also good examples that are helpful. These are, it tells what actions they need to do. For example, in terms of, as I mentioned, we need to review existing policies, plans, and programs, and also review the epidemiological data, get inputs from various stakeholders, identify gaps, and then come up with the concrete step of actions that can be undertaken. We need to ensure that we take a human rights and equity perspective. The role of different stakeholders needs to be identified. The financial implications are extremely important. And last but not least, involving people with lived experience. Nothing for us, nothing for them without them. And these are some of the examples, for example, we hear from people with lived experience when they are involved. And they are involved in many efforts. These are again some testimonies. I use my personal experience of stigma to advocate for the rights of people living with epilepsy. Today, when I meet a child with epilepsy, the first thing I do is hold their hand. And with this, I wish you a good rest of the meeting, and apologies that I can't join you in person. Thank you very much.
So we are obviously saddened that Dr. Dua was not able to come to Brussels and participate in our conversations, but still, we wanted to follow after a talk with a panel to address the issue of implementation. As we know, this is very often the key challenge when it comes to WHO action. And I'm pleased for that purpose to welcome not only Professor Claudio Bassetti, wearing another hat as chair of the Swiss Brain Plan, but also Professor Christopher Chen, flying over from Singapore, Dr. Jenny Young, flying over from Canada. Thank you both for making that long trip for us today. And Dr. Henrik Persson, Secretary General from the Norwegian Brain Council. So, Jenny, I'd like to turn to you first to share with us maybe the experience of and maybe a report back on the recent developments of what has happened over in Canada, and how you are actually addressing the political turmoil with your change of government or semi-change of government. That's also something we may take inspiration from, as some of our European countries are also facing similar situations. So over to you.
Thank you. Thank you so much. So it's a real honor and pleasure to speak with everybody here today. I think that the challenges that we have faced in trying to create a national brain plan for Canada, brain health plan, but also just the political situation that we're navigating. I think we have this in common, unfortunately, with a lot of other countries in the world. So I'm really grateful to be here, and I look forward to learning from you all. So to give you a bit of the history, in 2011, Canada made a bold move in brain research by launching the Canada Brain Research Fund. And this was a $100 million initiative designed to be matched by partners to fuel fundamental discovery science. And this really preceded a lot of the brain initiatives in the world. But over the past, decade and a half or decades, Canada has really lagged behind our G7 counterparts in overall R&D spending relative to GDP. And we've really failed to scale our brain research into real world impact. And some of the barriers that we have has been in the fragmentation of research. We have a federated healthcare system and has siloed fundamental research from translational science and public health and policy implementation. Our funding itself is also divided into health, social sciences, natural sciences, kind of operating separately and granting councils, making it harder to build an integrated approach. And finally, we've seen fragmentation in terms of national strategies, where we have national strategies in dementia and autism, mental health, for example, and brain injury, and they all have, you know, their individual needs, but what we've really been lacking is a unifying framework for brain health across the lifespan. And the fact that we had to call ourselves a brain research strategy really speaks to the problem that, especially in Canada, research is considered very separate from health, even though we are all talking about the same thing when we mention a brain health plan, but we always have to say specifically that it includes research. So in building our national strategy, which is in effect a roadmap for a brain health plan for Canada, what my slide shows is really the different stakeholders we brought together. So we have the directors from the top about 40 neuroscience and mental health institutes across the country. There's patient advocacy groups, research funders, health charities, and industry and private foundations and so forth. But the shift in moving away from trying to just address a research question came from our early career researchers to really focus more on how we're carrying out brain research and why is it not having that impact on health. And so, you know, this kind of rethinking has really brought, has underscored, you know, that old linear pipeline that we have where there is discovery research and then, you know, 10 years down the line, it may translate into something useful. You know, now the pace of discovery in brain is so fast that we really can't use that model anymore. And we have to have a more circular and iterative version. And so that's what our strategy is trying to enable, those kind of infrastructure and structural changes. And we have gained policy traction in Canada. For example, our proposal for what we're calling a Canadian Brain Research Initiative was included in the Finance Committee's recommendation for Budget 2025. And then here's where the political turmoil comes in, because we don't know if there will be a Budget 2025 or how that will work. And you know, this is just a time broader of you know, geopolitical instability and economic uncertainty and climate challenges. And making brain health seem urgent is really difficult. And so what we really need to do, and I think this is the intention of all of the brain health plans we have here, is the need to embed brain health into the broader societal systems. You know, and many colleagues around the table here have been involved in framing and putting forward this concept of brain health as a key economic driver and determinant of the country's future prosperity. And it's why we need to position, you know, brain health not just as a research investment or health priority, but an economic, workforce, and societal imperative. And so with Canada holding the G7 presidency this year, we are hoping to really push Canada to take the lead. And to towards that aim, we are organizing a Brain Economy Summit in Calgary that will happen June 13th and 14th, right before the Leader Summit. And I really hope to see all of you there. It's about trying to structure brain health in line with the priorities of all the G7 engagement groups. And I can tell you more about that later, but I don't want to take up everyone's time.
No, not at all, because time is yours. Well, or you have to divide in four. But Jenny, it's quite impressive to see the number of logos and organizations that have been involved there. I guess that like herding, you know, them must have been quite a challenge, and aligning across those priorities. Would you say that the research angle of your strategy was helpful in getting this as a kind of first milestone where they could agree upon in order to bring them forward? And the sub-question is, what was the positive impulse that you received from the WHO action plan that we heard about a minute ago?
Yeah, so what's been really great to see from the WHO action plan and just from being in these international conversations is that we know that we can't silo specific diseases. As scientists, we know that there's common underlying mechanisms. If you speak with patients, you know that they cannot be, you know, put into one category or just one brain condition. And so building that system to acknowledge that is what has been a gap. You know, we can't just have grant-specific, grant-driven funding, which is very important and very underfunded in Canada. But on top of that, we need the non-grant specific stable funding to integrate across these areas. And I think because we found those commonalities between the diseases, between how our research funders have been funding, that's how we were able to bring everyone together. It was very clear from the beginning that the funders, the patient groups, they were here not to fund our vision of a brain health plan, but because there are shared needs.
Yeah, and so you mentioned that this notion of brain health being a contributor to economic development. That's equally an agenda that we are using at European level, also because science and science-based innovation is like seen as a motor to economic recovery, development, and all the rest of it. So the agenda around brain health, brain skills, and the brain capital being a contributor to brain economy. You were alluding to the fact it's not paying off in Canada,
Yes.
and then entering into the scope of the G7 priorities. So can you tell us more about that?
Yes, thank you. So brain capital was actually a term coined by a Canadian. He was Michael Wilson was a finance minister at the time. It was in the context of mental health, but he saw it very much as a brain condition, a brain-based condition. And so we're really trying to lever that history and so that we will build on it. So at the summit, what we are doing is to try and align the priorities of not just the G7 leaders, and their concerns around productivity and prosperity, and in Canada in particular, even sovereignty, because we're so reliant on US support. It's also to align it with those other G7 engagement groups, so Business 7, Science 7, Labor 7, Civil Society 7, Think 7, Women 7, Youth 7, and for each sector to recognize its role in building the brain economy and how brain health is important for their priorities. And so in that way, I think this is how we can bring brain health to get the attention that is needed right now. It is to integrate that. And also by bringing together all of those other sevens, we will be able to make progress regardless of whether we get federal, national level attention or not. And I think there's, in other countries, there's already been success in bringing these other sevens into the conversation. So that's, I think that's how we can continue to lever and guilt each other's countries and nations into doing what is needed.
No, that's great, and thanks. I think that you put the panel on the launch pad. I'd like to invite you, Claudio, to maybe give us an update about the developments with the Swiss Brain Plan. And in doing so, I'd like to invite all panelists maybe to think of a question or a challenge that you would like to ask to each other, because you will each be resonating from, let's say, the same route, but you probably will each have applied it in a specific manner and adapt it to a specific context. And I'd like to hear what are, let's say, the common points and the differences in doing so. Claudio, over to you.
Great. So I would like to cite two statements that were just made. The first one, no size fits all. So this is not going to be a recommendation for other countries. This is just one example, and obviously to do and develop brain health nationally, you need to understand what are the needs, gaps, and what are the options of the given country. And the second one was we should avoid fostering silos, as you said, and I think the main effort around the Swiss Brain Health Plan is really to bring together people and recognizing and promoting brain health and prevention of brain disorders an advantage for everybody and for all patients, and not just for single disorders or single organizations. Now, I will not enter this slide much in details. I think it is now well recognized, at least around the table, maybe not in the world yet, that the burden of brain disorders is very high and actually increasing. In this cartoon, we see that the frequency of brain disorders and mental disorders is incredibly high. In terms of disability, they are leading, unfortunately, the list of disorders worldwide, and the costs are also very high in this old summary of the costs in Europe. The brain disorders were accounting for more costs than cardiovascular disorders, diabetes, and cancer together. Now, it was mentioned by our MEP that there are many reasons why this burden is so high and actually increasing age, stress, COVID, climate changes, sleep loss, addiction, many other factors, including some technical aspect that we will not get into, how these disorders have been classified in the past, actually explain why the burden is so high. Now, the second message of a background, and I will not enter again into details, this is well known to all of us, is that we start having means to prevent brain disorders. Now, I bring two examples. There could be others, including epilepsy in the world, but two very dramatic examples of how brain disorders can be prevented are dementias, and the recent commission paper published in Lancet estimated that up to 50% of the phenomenon dementia may be prevented. I would like to mention maybe more vascular dementia than neurodegenerative dementia. And on the other side, we know that at least 60% of stroke, of the stroke phenomenon can be prevented. So we have means to prevent brain disorders, and this is why we need to develop strategies to prevent brain disorders, but beyond that, to promote brain health. Now, it was mentioned in the last 10 years, mental and neurological disorders, in other words, brain disorders, have been recognized by the WHO as a public health priority, and 3 different plans have been developed in 2013, in 2017, and in 2022. Now, as you will see in a moment, the Swiss plan wants to take into account the fact that these 3 plans and these 3 activities could and should be brought together. We actually launched our plan in 2022, and the main paper was published in 2023. And these are the 5 main strategic pillars of our strategic plan: raise awareness around brain health and brain disorders, promote interprofessional training. Believe it or not, even in Switzerland, we are facing with shortage of workforces, and we need to educate a new workforce and not only invest in neurological, neuroscientists, neurosurgeon, etc. I have shown you that up to 50% of the phenomenon dementia is known and can be prevented. I could actually start saying that 50% is unknown, and that there are many other disorders that are much less known in terms of the mechanistic origins of their occurrence. So we need to invest in a better understanding of the mechanism of brain disorders and eventually the determinants of brain health and brain disorders. We need to join forces around the promotion of brain health and prevention, and it cannot be done just by neurologists, neurosurgeons, neuropediatricians. And finally, last but not least, the voice of the patients and of the caregivers must guide our priorities and our choices. Now, very often I'm asked, so what is different, or what do you think it's specific for the brain health plan in Switzerland? And I actually phrased this with 4 answers. The first one is that we don't make a difference between neurological and mental disorder. Well, there is a difference, but we see as both being linked as 2 sides of the same coin. The second is that we want to exit the silo of single disorders, and this is why we want to promote a holistic approach. We want to promote brain health, but also prevention of brain disorders, and this includes, in our view, also early detection and early interventions. The overlap between prevention and early intervention is a continuum. One effort and one maybe success of our plan so far is that we have included from the beginning all potential stakeholders, not only in neuroscience, but also psychology, nursing, general practitioner, public health specialists, and we have over 20 societies that joined our activity. This is probably difficult, the most difficult step that we had to undertake. We have also linked, and this has been also a challenge, with the main stakeholders in Switzerland to promote and to pay for prevention, which is obviously only a very small percentage of our health care as expenditure, less than 3%. So we have the Federal Office of Public Health, Promotion Santé Suisse, which gives the money, and the Conference of Health Directors. We have 26 health directors in a small country, so this is per se is a challenge. So what did we do in this first year of existence of the plan? Well, we have been engaged, as I do today, in promoting awareness on international and national events. We have launched a certificate of advanced studies, a university course on brain health, open to different professions. This is an international course which is held in English and it's open to everybody. I will come back to this in a moment. We have started to perform studies in Switzerland on the cost of brain disorders and sleep disorders. Sleep being considered one of the determinants of health, as movement, exercise, diet, and social context. We have launched 2 national flagship prevention projects on headache on the workplace and sleep disorders. And we are working together with multiple patient organizations, creating a discourse and actually a joint action around the different organizations. Now, a few lines of a few slides about the data. Today we have 2021. We could find the data on brain disorders in Switzerland, and not surprisingly, they exceed the cardiovascular disorder by double. So this is real data from Switzerland, just confirming what has been stated in international publications. And if we look now at the details across the life course, starting from young age to the old age, you see that in elderly patients, age-related disorders prevail, stroke and other neurological disorders. If you go into the younger section, mental disorders prevail. And what I would like to stress is that if you look at the burden on women is higher than the burden on men, and this is also of great concern. If you look at the cost, this is the evolution of cost of brain disorders in Switzerland from 2000 till 2019. We are unfortunately again top on the list in terms of costs in the health system in Switzerland. And you see that the main drivers of the cost in Switzerland are dementia, headache, anxiety, and depression, just because they are either frequent or they actually create a burden across many decades. And this is the explanation for this list, but obviously many other disorders contribute, including epilepsy, etc. I'm happy to say that the launch of this international certificate on brain health, it's a university degree that you receive from our university, has been launched very successfully. And we have at the first publication of this call already 37 students coming from 16 countries. And I'm happy to say that we have a very strong interaction with our African colleagues and with Professor Nyamshi. We are very tightly linked with the Yaoundé Declaration Initiative, and we could sponsor a few students from outside Europe. I will not go into the details. I think a national brain plan must take place over the nation and should not be linked to a single center. So you see here the different activities: awareness, education, research, prevention, and empowering patients across the different academic centers, but we want to extend these activities in Zurich, Bern, Lausanne, Geneva, Basel, and Ticino. And we have been linked with many other networks, nationally and internationally. I'm coming to the end. We are now working on the importance of wealth for our society, and importance of brain and also sleep capital. So we have been contributing to international publications based as some of them at least on data. And as it was mentioned by Jenny, we see actually brain health as a contributor to health, but to overall societal and world health. And this is a paper that actually documents this approach in Switzerland to go beyond the brain, to go beyond the body, to go actually to the entire society. One brain, one mind, one health, one planet. I finish with this invitation. We go to Canada, but before we go to Canada, we stop in Bern for this international event. We will have 20 countries reporting on their experience, and some of them are here. So please come to Bern, and thank you for your attention.
Thank you very much, Claudio, and I'm sure that there are plenty of issues or points that you highlighted that we can come back to in the course of the open discussion that will follow. Before this, I'd like to turn to our next panelist, Christopher. Chris, you also made a long trip to come to us, so thank you for that and for your commitment. But we were eager to hear from you the situation in Singapore. So we were told by many in the room that the country is boiling with the implementation of the WHO action plan, but with some particular features, and we look forward to hearing that from you.
Thank you so much. So Singapore is also affected by global geopolitics. We have been, for many years, thought to be extremely close to the West. So I always thought we were the 51st state. But so it's a bit disconcerting to find that Canada is. But jokes aside, certainly we sympathize with colleagues from all around the world. And just to say, Singapore is perhaps not terribly generalizable. We're a very small island state, 5 million people. It is completely clear to the policymakers that brain health is extremely important because we don't have any natural resources. We only have our people. So currently, we're in a happy situation that we don't spend very much on health, but achieve very good outcomes. But we know that this is just a quirk of demographics and history. Our populations are rapidly aging. We know what kind of non-communicable diseases are increasing rapidly. And as you've heard from Claudio, we know this is going to drive dementia and stroke. So we can't stay still. So I'm presenting on behalf of my colleagues, Helen Cho, Evelyn, and Michael Chi from the National University of Singapore, to say that what we have in Singapore is not a brain health plan. We just have a health plan. And the brain health is just part of it, and hopefully an increasingly important part of it. So the fundamental reform that has come about in the last couple of years is the Ministry of Health has introduced something called Healthier Singapore. It's something that all of us know about. It's basically emphasizing the role of primary care, the role of community care to help patients stay healthy. You don't have to go through all this. I think that many developed systems already have these things in place. But on top of that, we recognize that there are certain populations which are extremely vulnerable. So Age Well Singapore is an important component of Healthier SG. And the government has decided to go and spend at least what is for us a lot of money to develop services for the aged. And, I think we've skipped a couple of slides. Doesn't matter. The other slides just say that Age Well underpins Healthier Singapore. We know that we're going to have to put a lot of priority in helping our elderly patients stay in the community healthy, to stay away from hospitals, to stay away from nursing homes, and hopefully they're going to sort of come and visit Switzerland and Belgium and buy their chocolates and things like that. In addition to the aging population, of course, we recognize that we learn a lot from other countries and international research on how we can implement lifestyle changes. So We have taken on the lessons from the Finnish finger trial, and we are part of the worldwide finger collaboration. And we are currently conducting I know this is not very inventive, it's a Singer trial in Singapore. We've completed recruitment. We should be completing the 2-year intervention at the end of this year. We'll have a readout about what are appropriate lifestyle interventions for an Asian population in Singapore. And importantly, we'll also have a lot of ancillary biomarker data to see what is the underlying mechanism for any advantage that may accrue from lifestyle changes. In addition to aging and lifestyle, we also realize that sleep, as Claudio has mentioned, is a very important, perhaps brain-specific initiative. So we have a lot of sleep initiatives which concentrate not just on the elderly, but also childhood, adolescents, students, working adults, as well as older adults. And this will drive us to provide proof of concept studies, as well as evidence-based policies to improve sleep quality and hopefully neurological outcomes. In addition, we have so despite the fact that we are kind of a poster child for lower birth rates, we really consider young children to be very important. And so we have put a lot of research efforts into all these studies of prenatal, antenatal, young childhood policies to go and try and make sure that your brain is as healthy as possible before all the terrible things that happen to you in adolescence and adulthood. So this will merge into a brain health and mental wellness hub. We hope to go and sort of work with partners to come up with better interventions, evaluations, and policy recommendations. So this is what we're doing in Singapore. Thank you very much.
Thank you very much, Chris. I'd like to turn to you and Rick next. Well, thanks for agreeing to be with us this afternoon. But we very often cite Norway as a lead example in Europe.
Thank you.
But now you've heard different examples, and including from outside of the EU specifically. That's basically where we can say Norway and Switzerland are also part of. But how do you see that we can bring those learnings back on the European continent, and also having a longer history in the development of the plan and the implementation of the plan? How do you reflect on this evolution? And what sort of advice would you have for your colleagues around the table in terms of what challenges are coming up next for them?
Thank you very much, and thank you so much for inviting me here today. It's an honor to be here. I find it quite interesting, actually, because it's correct that we in Norway established the first brain health strategy in 2018. Based on a status report from 2016. So we have a lot of years behind us with experience on working on brain health strategies and political collaboration. But in Norway, we are actually now establishing the next brain health strategy. The last year, it was said from the government that the first strategy ending in 2024 would be prolonged, and we have spent the last year on making a new strategy in collaboration with the Directorate of Health. And you asked me if I have any advice to the other countries, but I actually find it very interesting that we are learning as much from the other countries when we now are going further on with our strategy. I think we still have some of or a lot of the same challenges. We all have more or less the same main goals and probably also sub-goals. We need better prevention, we need better research or more research, we need the better treatments, we need more awareness. So the main goals in the strategies are more or less the same, I think. But the difficulty to actually have them implemented down to measures and action points, that's a real challenge that we not have overcome in the first period with the strategy we have had. So we are still facing a lot of the same issues that you all are, and that we all are. So I think my best advice would be to follow up what Bassetti said earlier on, that we need a holistic approach and we need to join forces. And I think that is probably a couple of the main points from Norway, that we have the last year talked a lot about, that our brain health strategy, or the next one, should not be a strategy that names goals from other strategies, because there's a lot of plans and strategies in different health areas in Norway. But the aim we have in our collaboration now is to find the goals or the measures that actually fills the gaps between the other plans and strategies, and also have a more holistic approach to brain health, to find similarities between the diagnosis, to find new targets for research where we actually can research on similarities, not diagnose specific research only. So I think the holistic approach and really joining the forces broadly within the country. The last year, the Norwegian Brain Council has represented 78 organizations, medical professional associations, and researchers. And what I think has been most important for our work the last year is really listening and discussing with our members to find what we have in common. We too often focus on what is dividing the different diagnoses or what's the differences, but we really have to focus on what is the things we have in common. Yeah, I don't know if that was a clear answer to your question, but there's some thoughts from Norway. And I also have to say I'm excited to see how many new countries coming up with plans these days. It's really exciting to see, and I think it's a part of a bigger movement across the world that brain health is taken more seriously. And I really think we have a lot to learn from each other, either if we have been working in the field of brain plans for 10 years or 2 years, or we're just starting, we have a lot to learn from each other.
Thank you, Henrik. No, definitely. I think you equally deserve a round of applause. No, but it's quite impressive to hear what you're saying, because I remember entering EBC where everybody was looking to the Norwegian Brain Council as a success story, that you had or were about to have the first strategy. And now we are even more impressed to understand that there is a strategy 2.0. Now the question is, how did you achieve that political buy-in? Because you managed to have one, but how did you justify this continuity? Because we can definitely identify sustainability of the effort as being one of the key issues. And I'm tempted to ask you what sort of success you could demonstrate to your government in the implementation of the first strategy in order to justify the continuation of the effort. And what were basically the KPIs that you were using in measuring the impact and measuring the influence of your action?
If we're looking at things we achieved in the first strategy, I think I've said this a couple of times in different forums, but we didn't achieve that much, to be perfectly honest. We had the establishment of a research center called NeuroSysMed, which is researching on neurodegenerative disorders. And we had a couple of achievements. But I think the main achievement from the first strategy was actually the establishment of a partnership with the Directorate of Health. We started to cooperate, and we have been cooperating for the last years, and we're talking to each other on a weekly or second weekly basis, discussing what are the main issues and what are the next tasks we have to prioritize together. So I think this also may be the main reason that we are having a new strategy, because we have learned to cooperate tighter, and also that we are representing, as I said, 78 different organizations with one voice. It makes it a lot easier for the health authorities to grasp what we are asking for.
Yeah, thank you, Christopher. So you react. So is there anything you'd like to say, or maybe you feel Henrik is too humble?
Not at all. The difference, of course, is that in an Asian country like Singapore is very top down. So we're very blessed that our civil servants are not just honest, but they're also quite clever. So they have taken a
Lucky you, it's not a given, you know.
That's why I say we feel blessed. So they have thought this out quite carefully. They have interacted with professionals, and very often what they say is sensible, and we just get on and do it. So it's not like Canada, where you have to herd a lot of cats and a lot of different states, etc. The policies I expounded on are well thought through. We have political stability, we have economic resources. So I think we're a lot like Norway.
Well, the good news is that you don't have to be. But Jenny, Henrik was saying 78 organizations, nothing that can impress you, obviously. But in terms of the achievements in Norway, how does that reflect to the state where you are in Canada?
Yeah, no, I think that I appreciated how upfront you were about what did we actually achieve, because it's really hard to measure, the type of achievements and find the right KPI. And I think that has been a big challenge in Canada. There's Ministry of Health, and then there's research under Innovation, Science, and Economic Development, and it's getting everybody to talk together. And I think that's why, what we hope to achieve with this push for the G7 is having people understand that it needs to be integrated. We can't just silo research alone, or research in health and have health separate from science, and then have public health agency as yet another department. So that's really fantastic that you were able to build that relationship. Definitely something for us to learn from.
Yes, Henrik, please.
I just have to add one thing when we're talking about achievements, because to be clear, of course, we have a lot of achievements in different strategies or different plans. We have a lot of initiatives, for example, within dementia or in mental health, and different plans and strategies, and a lot of great research. So we have a lot of different achievements, of course, during the last years, but connected solely to the brain health strategy, I think it's the holistic approach, the awareness that you can actually talk about brain diseases as a category. I think that is the main achievement we have, and the collaboration with the authorities on that topic.
But I'm tempted to ask you, how do you find it, let's say, or you find a concrete way to implement this? I was particularly intrigued by what Chris was saying, by focusing on kids and younger generations, or younger age, for instance, as being, let's say, one way to catalyze that. Is that something you would see could be an approach?
Absolutely. We have in the brain health strategy, we have 4 main goals divided into sub-goals. And we have actually some sub-goals pointing in the same direction. We have one sub-goal that says that we have to map out weaknesses in the maternal and prenatal care to strengthen children's brain health. So we're, I will say we are actually also in the next strategy probably going to focus more on young children, small children. But I have to wait and see what will be the concrete action points and the measures, because the plan is, as it is, divided into sub-goals, not measures and action points. So, but I share the importance of prioritizing youth and children. Absolutely.
Thank you, Christopher. That must resonate with your health plan in Singapore, that maternal care is seen as an integral part of, let's say, the way we would define a brain health strategy.
Yeah, we have so few children that everyone is important. And of course, we know a lot from research about how parental health really impacts child health, both in utero and over the life course. So yes, a lot of investment is going into that to make sure that this is optimized. But we're not, of course, not forgetting that everybody needs support. Because I have children who have now entered the workforce, I now realize that it seems so much more difficult now than it used to be when I started off. So I think we're realizing that they need a lot more support. There's probably too much social media, too many comparisons, and we're trying to go and sort of intervene there as well. I know that we saw in Switzerland how there are many interventions to try and make the workplace a more healthy place for the brain. So we would try and move on that. And finally, of course, we can't forget the aged. They're the most vulnerable. And if we spend the rest of our life without brain health, it's going to be the most costly drain.
Yeah, I have one comment. I agree with everything has been said. What most countries will face when developing a brain plan is the fact, and it was alluded to, that on one side resources are not increasing. I mean, most countries, even Switzerland, Singapore, Norway, are not facing the best period of time in front of them. So, I mean, you need to realize that there will not be a piece of cake ready for brain health to be taken. The second is that in most countries that I'm aware of, at least in Europe, there is not much money for prevention. I mentioned that in Switzerland is less than 3%. So if you say, well, I want to prevent brain disorders, everybody agrees, but nobody is ready to give money. And the third difficulty is that the field is already been, I don't say occupied, but at least has been already made busy by multiple activities that actually deal with the same goals. I mean, we have dementia, we have stroke, we have mental health, we have, you name it. So, I mean, I'm coming maybe to one kind of reflection that we are doing in Switzerland. It is obvious, and this has changed for Switzerland in the last 2 years, 3 years since we started. It is difficult to think about a brain plan that will be in the proper sense of the word, a brain plan, but I think we need to capitalize on what is there and see how we can add in and actually provide something that create a synergy between the different initiatives. So I think this is, in my opinion, and I bring now 3 years of efforts, this is probably the most important challenge, how you can bring people to believe that doing things together will be a profit for them, even if on a first sight it may look like a loss of control. So I think this is the big challenge that we will face. I don't think there will be any country that will say, well, get the 5 billion and do a brain plan out of scratch.
Thank you, Claudio. I suggest that we pause this conversation now. We'll come back to it, and you will all be invited to ask questions if you have any. So think of it already, scribble on your notepad. As I'd like to turn to a very special guest in our event today, a friend of EBC and of the brain community, Professor Alfred Nyamji, having flown over from Yaoundé in Cameroon. And we were just discussing and alluding to the fact that brain health is a contributor to economic development and prosperity. And Alfred is coming and is here with us this afternoon to present the plans and the efforts that he has made personally in Cameroon to have the Yaoundé Declaration coming to life. And Alfred, it's really an honor to have you. So over to you for your presentation, and looking forward to the conversation afterwards.
Thank you very much, Frédéric, and thank you, Claudio, and everybody here. It's a real privilege and honor for me to be here. I have never been to the European Parliament, and so I consider this a very, very special honor to be here, and thanks for the invitation. If I can have my slides, I'll just share with you a few thoughts on the Yaoundé Declaration and how it relates to the conversation that we're having here. The declaration is actually called the Yaoundé Declaration on the Brain Economy, Brain Health, and Brain Capital. And when I was asked to share these thoughts, I thought that I should insist on the fact that, on the argument that brain health is essential for global economic growth. We've heard that from Claudio, we've heard from many. Brain capital resilience, we've had that definition given already, and well-being. If the brain does not work, the rest does not matter. I have no thing to disclose as far as this presentation is concerned, apart from that Africa produces a lot of fruits and grains that are good for the brain. And we know that from the womb to the tomb, we have only one brain. We might have 2 lungs and 2 kidneys, but we have only one brain, so we have to take care of it. And it's been said that there can be no sustainable development, economic growth, and wealth creation without health, as there is no health without human brain health. But the unfortunate thing is that our brains are really under serious threat. We've said that already. Apart from the biological threats that we have and the bioinformatic threats with AI and technology that we have inflammation. I have the impression that everything is burning up. Our brains are being inflamed. Society is inflaming. Christopher just mentioned how it's difficult now for children to work. Our planet is inflaming. Micro and macro environments, biological, economic, are inflaming. Everything is inflaming. So we have argued that we need to use neuroscience to understand the brain economy, and we have proposed 4 ways of how we can transform this inflaming, toxic economy into a more brain healthy economy. You've seen this before. Claudio presented this paper to you, in which we argue that the bioeconomy transition, the care transition, the digital transition, the green transition, that is expected to produce more productivity and more economic stability and security, needs brain health. We need our brains to be healthy for all of this to happen, because all of these endeavors come from our brains. And Jenny already defined brain capital, so I don't need to dwell on that. Brain health plus brain skills, as Tarun divided brain health, brain skills including creativity, resilience, especially critical thinking and systems thinking is what we need, because the issues we're discussing cut across disciplines, across sectors, and we need to have experts in systems thinking to be able to handle these as we work together. So the Yaoundé Declaration was an attempt to call the whole world, global call, regional call, national calls, for us to transition from a brain toxic or brain unhealthy economy into a brain positive economy. And it builds on strategies and also works that have been done with Africa appearing to play a key role in this movement. The structure of that declaration builds on established institutional instruments, diplomatic instruments, like the Declaration of Human Rights and many other United Nations, WHO, UN declarations. It builds on all of that work to establish the current and future global challenges that allusion have been made to, and then affirms that we want to work together, that all of us want to work together, because no single person can do it together, no single initiative can do it, no country, no region, we have to work together. And then it goes on to make the calls that I'll share some of them with you in a moment. This declaration benefited from an overwhelming global support and contribution from over 100 experts from around the world. Several of you are sitting here, and I want to thank you. And the government of Cameroon participated with more than 30 sitting members of government actually involved in this, and with diplomats and all that. So these are some examples of the statements that I pulled out from that declaration. It recognizes the convergence of global factors and conditions, environmental extremes and all of that, recognizes that our current socioeconomic paradigm is insufficient for addressing the complex multi or poly crises as we describe them, recognizes the role of Africa and other low and middle income countries of the global south, which have rapidly growing economies. They have a role to play in that new economy that we all want, recognizes the importance of science and innovation, recognizes the global burden of brain disease. We've seen figures on that already. Recognizes WHO's instruments, especially the IGAP, which is the most recent one that Claudio and Tarun talked about. And of course, it recognizes the importance of women's brain health, as we know that there are differences in gender as far as brain health is concerned, health in general, but brain health. And then that affirmation, we affirm our commitment to work together in a unified and focused effort to preserve the rich diversity of humanity and our planet, and to reduce disparities by fostering the brain economy, brain health, and brain capital for the well-being and security of all humans and our planet. So what are some of the examples of the call? There's a call for international frameworks for transitioning into the brain positive economy and encouraging countries to have national brain plans. We've been discussing that. There's a call for international data creation, curation, and tools and frameworks to support and sustain the promotion of brain health. We've been discussing that already. And there's another call for the establishment of a global brain council that cuts across all stakeholders. It's another call for the creation and the sustainable funding of a global brain capital center of excellence in Africa. Why in Africa? We have the youngest population in Africa and the highest burden of brain diseases in the next few years, decades, will be in Africa. So we think that that continent can provide that kind of capacity building. And then there's a call on the United Nations General Assembly to consider to formalize this, and this is ongoing work. And other fora are invited to take up this, and I'm glad to share with you that we already were able to present this at the United Nations General Assembly. I'll show you some things on that. World Economic Forum, and we participated in the G7 preparatory meeting, and that went into the concept note, and we're looking forward to the G20 that will take place in South Africa. The Yaoundé Declaration has been a long journey, and the journey goes on, and being here is part of that long journey. And I don't know if I have a few minutes again. I would just like to let you have the environment of what happened in its scientific meeting for a few minutes.
Every endeavor of the human being depends on the state of their brain. And if we have healthy brains, we can be able to be trained, to be educated to do things like farming, like doing journalism, like doing politics, doing business, going to school, studying.
The brain economy transition is meant to be a global transition. It's meant to incorporate people from global north and global south. So it's essential to be here in Africa, which is so critical to the future of humanity, to the future of the global economy.
Brain health, that's an area that has been kind of left behind. But we see how important it is now with the rising age and rising populations, and the ages are rising.
Africa is bold and courageous. Africa wants to lead through Cameroon. I think that we have a really bright future for this brain economy transition. People are starting to recognize that we really can't achieve the green transition, the clean economy transition, unless we have a brain transition, unless we help people to improve their brain health.
This scientific meeting gave rise to a political and diplomatic meeting where the president of Cameroon endorsed this declaration and asked the prime minister to represent him to receive it and take it on the diplomatic handbag of Cameroon to the United Nations so it can be incorporated into some UN instruments in the future. And these pictures show you that meeting. About 400 people came together with the prime minister of Cameroon leading in that. This is a paper, thanks to Elena, that we had published in the Lancet Neurology about the declaration. And I'll just, as I close, let you listen to a few words from our Prime Minister.
Representing Africa's voice at the upcoming United Nations General Assembly is titled the Yaoundé Declaration on the Brain Economy, Brain Health, and Brain Capital. On behalf of the head of state, the government of Cameroon extends its congratulations to BRAIN and all its global, regional, and national partner organizations, as well as the leaders and experts who have tirelessly contributed over the past few months to the creation of this historical document. The President of the Republic extends special congratulations and pays tribute to all who have supported this program, which will be presented at the Brain Days during the Science Summit of the United Nations General Assembly 79. I'm referring here to Professor Alfred Jamshi, founder and CEO of Brain Research Africa, and Professor Harris A., founder and director of the Brain Capital Alliance and head of the Neuropolicy Program at Rice University in the United States. Both of you have shown that race, culture, distance, and age differences are not obstacles, but assets in connecting minds for the well-being of humanity.
So this was a presentation at the Science Summit at the United Nations, and the current chair of the General Assembly received us after that. And I would like to end my presentation by quoting the Vice President of the EBC, who echoed this Yaoundé Declaration at the European Parliament, and he's sitting right here. He said, "This broader understanding of the crucial role played by the brain as a powerhouse of our societies has been acknowledged by Cameroon, currently chairing the United Nations General Assembly through its Yaoundé Declaration, calling for brain health in all policies," as Claudio. So as I mentioned, the Yaoundé Declaration has contributed to the concept note of the G7 summit that is going to take place that we heard about. And I would like to acknowledge all the partners that have helped us, and all of you colleagues from around the world that have helped us to build this movement around the Yaoundé Declaration, which is now an instrument that we can use at regions and at nations for policy and for diplomacy, brain diplomacy. And I would like to thank the EBC for inviting me. I would like to thank our government for the support that we have had, and the African Union for the diplomatic and political support at the African Union. And I'm really honored to be here at the EU Parliament.
So thank you very much, Alfred. And it's now time for an open discussion and a round of questions or comments for all of you. And Alfred, next time we promise we bring you to the plenary of the Parliament. It will look way more impressive.
Okay, thank you.
Is there any comments or any questions to our panelists, as well as to our keynote? And if you are not sat at the table, please come to the fore so that we can get you. Yes, Mara, please. So Mara Dirsen, who will speak later, President of the Spanish Brain Council. Mara, over to you.
Yeah, thank you very much. Thank you to all the speakers. It has been really inspiring, I have to say. And many things resonate to me as also our problems, right? So concretely, I wanted to ask Jenny, because you mentioned something that is also happening in Spain, how the basic research, the knowledge that we gather in the labs is or not, mainly not, translated into something practical, right, in clinical practice. So can you elaborate a little more on what are the actions and the measures that you are taking for that?
Yes, thank you so much for that question, because I would be curious to hear if this is just a uniquely Canadian problem. I mean, our funding is just so small in Canada. And so one thing that we've really found through all of our consultations is that there's no training on how to translate this research. And as a recovering academic, I used to do basic research. We were not trained to think about where does that knowledge go. And that old model where it's like a relay race and you kind of you're supposed to hand the baton of knowledge onto the next runner, except that 90% of the time it's just kind of thrown on the ground and you hope someone finds that baton. So a big part of this is training, and the thing is we have pockets of these training programs across the country, whether it's building that innovation pipeline and teaching scientists how to be entrepreneurs and thinking about how they bring that outside, or it's training them to work with patients and training patients to work with researchers. there's pockets of these around the country, and what we need is to scale it and make it accessible. And that requires non-grant specific funding. And our research system is very much grant-based right now. The other common needs that we have are, it's very boring, but just data sharing and enabling that. We have a strong culture of open science in Canada. So I do have to say it hasn't been that hard to herd all the cats, because we have this culture, but there's no investment in the coordination piece. And, you know, just to have the research personnel to support connecting all these different data sets and enabling people to contribute, that's a very not sexy, you know, grant-driven kind of thing. And that's why we make the argument that that's why it's a government responsibility. And it shouldn't be up to these individual organizations that have been funding research like that. And that's why all the funders and health charities are on board. Because when that data is pooled, it doesn't matter what, you know, question you're asking. It doesn't matter if you're doing clinical research or if you're doing basic research. This is where you will get the different, you know, people from different parts of that research spectrum coming together on the shared resources. So that's how we're trying to deal with it.
Thank you, Jenny. Elena? Professor Elena Moreau, President of the European Academy of Neurology.
Thank you very much. And I really want to thank EBC for what it's doing today, because I think that what we said we are learning from each other is really a great opportunity for each of us today. And I also take the opportunity to have Henrik close to me, because we are in Europe, we are diverse, but the diversity is something that we have to be proud, because really is something very positive. So you said we learn things from these 6 years since when you implemented your brain health plan. So can you share with us the 3 things that you would like the other people to avoid, that you think that have been 3 mistakes maybe, and the 3 important challenges that you want to tell us so we can really, you know, improve and help each other in this way?
And Henrik, if there are more than 3, I suggest we leave that for, you know, the drinks up.
This is a really, really difficult question. And I think one of the main problems is that I think the main problem we have working on the strategies, as I said many times before, is finding the measures, the concrete actions that we have to take. And on one side, when you are making a plan or a strategy, you have to talk about the actions. But the more specific the action gets, the more money it shows that it will cost. And the more, the bigger risk for the plan to actually get stopped. So you have to find a balance between a plan that is not very specific, so that you can get the political attention and support that you need, but at the same time have an opening that you will be able to take the goals down to concrete measures. So I don't know, this is not an answer to your question, because I really haven't found the optimal way of going forward on this topic. But I think, as I said also many times before, the collaboration is the main thing you have to take with you in this work. So a huge don't is focusing too much on diagnose specific problems, I will say. A lot of the stakeholders coming into brain councils or in brain health strategies have their own agendas. So listening too much to the diagnose specific challenges, I would say is a don't. Avoid it and keep the more holistic approach is really key. I think this was 1 or 2, maybe. Can you help me out?
Yeah, no, good to see that there were not, let's say, so many challenges or things not to repeat. But I'd like to take you on the economic arguments, because in the recent years there is a lot of effort being done on the health economic aspects of those investments and the return on those investments. And the EBC produced, I mean, a massive project on the value of treatment and demonstrating that any investment in improving the care pathway and improving outcomes for people living with a brain condition was paying off down the line. Was that an argument that you could use, or was that helpful in any way? Or do you see that we should still refine a bit, let's say, the argument there?
I think that we have a lot of arguments that brain health is important and it costs a lot. In Norway, we have been focusing on the global burden of disease, or the burden of disease in the category brain health. And I think that has been enough. The politicians understand that brain health is important. So I think what we need to focus on forward is to find the synergies and the reasons why we should look into brain health with a holistic approach. So we are not focusing too much on costs or measures that will cost money, but we're trying to find out what do we need to know more about. How can we map out the similarities between burden, between the different diseases? How can we make researchers cooperate better within in Norway, for example? So trying to find ways of moving forward without focusing too much on the costs per now. Claudio.
One comment. I've been working with the health system also at political levels for decades. Politicians know that whenever you say there will be a reduction of cost, they will not believe you, because it does not happen. So, I mean, as much as I welcome the idea of using brain capital, sleep capital, it does not convince them. Just because we live in a system where costs, anyhow, whatever you do will increase. And I think we need to develop a good narrative and maybe have some concrete examples of how this may work. Otherwise, just the idea, it's great, but I'm not sure it will be sufficient when facing the hardliner of, keeping the budget within a certain frame.
Or very likely the return is probably when they are no longer in power. So, Jenny, a quick reaction, and then I have a question from Morten and from Mika.
Thank you. And you're absolutely right. That's why we have never argued solely on health outcomes, because that comes outside election cycles. You're going to the example that I spoke about, needing to support research personnel. It's very boring, and it's sadly somewhat embarrassingly, because Canada's grants are too small to support these kind of positions. So we've been framing it as, these are the highly skilled technical positions that our government says they want to create, that if it was funded properly would be those powerful paychecks that are paying taxes. And another issue in Canada has been, when there's just not enough funding, sometimes we get into the mindset of cut off the tall poppies. And so people have kind of turned against the major universities that are getting most of the grants. And we say, well, there's no reason to do that, because they actually want to share. We just have to enable that to happen. So it's trying to find out, and that's how I've always approached our advocacy, is to think, well, of course, investing in research is important. Tell me, what are the arguments that we can give you so that you can help us advocate?
Yeah, I won't comment about the fact that we probably took it for granted for far too long, and then no investments into science and research is being challenged. Morten, and then Mika, and then a wrap-up from the panelists. Morten, over to you.
Thank you so much from the Danish Brain Council. And I totally agree with you, Mr. Bassetti, that no politician will ever believe that we'd say we will have cost reductions. However, on the other side, what they're looking into is also a lack of workforce, and a lot of people with neurological and mental diseases are really not within the workforce today. We made a survey that showed that if we could reduce the fact that they are not a part of the workforce, we could increase the BNP with between 3 and 4%. Now that's something a political person would look at and act on. I don't know if you agree, but...
Claudio, maybe we take the question of Mika and then we conclude.
Well, yes, thank you. Thanks for the presentation of the Norwegian project. So, as a neighboring Nordic country representative, it makes me, to be honest, a bit worried when Norwegian people say that money is an issue and it's difficult to get enough money,
let alone the Swiss.
Because unfortunately, I think most of us around the table might have even more worries about having enough finances. But yeah, I think one of the key things is how can we make the change stick in a way so that we don't only have project after project, and when the finance for a specific project ends, then you come back to halt and you don't really progress in a sustainable way. So I think this is one of the key issues, and unfortunately I don't have any like foolproof answer to this, but I think this is something we need to think very closely about, so that when we have various projects on brain health, how can we create some changes to society that are in that sense sustainable, that some things change really for good in a way that brings benefits even after decades. And I think this is something that's not easy to tackle, but I think would be very important. Thanks.
Yeah, thanks a lot, Mika. And it seems you guys have a light in order to tease beautifully for your panel later on. So maybe we don't address it. Mikael, very quickly, and then we make a round of conclusion. Please, Mikael. Yeah. Mikael, please use the mic.
Your point about maybe we don't make blanket statements, that we can save costs but use specific examples, begs the question for me, do we have those specific examples? And I know from your last Swiss Brain Health Plan Day, you shared one of them, or one of your speakers shared one of them. So I'm just wondering if EBC or some other forum could help us collect our various different examples so that we can share. This can lead to workforce productivity or other cost reductions, because I'm not always hearing about them except when I attend some of these events. So maybe this is an opportunity to share those in a specific place that we can all draw on.
Well, Claudio, I think it's a fantastic first action point we can line up for your conclusion at the end of the meeting. But please, over to you, as you receive 2 questions, and then we make a quick round and we move on to the next session. Thank you, Mikael.
Well, I think it was one question that I recall at least, and I fully agree. I mean, this is the type of activity that we should foster, and I stressed, because I was more and more asked also by our health minister. I met him twice, and he always looked at me and said, "Are you looking for money?" I said, "No, I'm not looking for money," although I did not look unsuspicious, I have to say. And the second statement was, "Are you thinking that we need more neurologists, more neurosurgeons?" I said, "No." And I think in the meantime, I'm convinced this is not really what we need. We need really new health forces that promote brain health, and we need to think about intersectoral approaches. This is why I'm looking also at what you do. And I think we need to change the approach. And if I say it in Switzerland, I think the other countries should follow, because we are very rich. And if I cannot afford, the other countries will not afford either. So I believe you're completely right.
Thank you. Henrik? And you'll have speaking opportunities later on, so you can just tease and keep it short.
Sorry, I totally agree with what Professor Bassetti is saying here. And we have also been looking towards Switzerland, and really would like more knowledge and into educations and health professionals that are not neurologists from before. So I think this is a very good example. Thank you.
Thank you. Jenny? Word of conclusion?
Thank you. No, this was really fantastic. There's so many different thoughts. I think that, we all have, I really like Michele's idea to pool our arguments, because we need to all speak it with the same language, and that's how we will trickle through in these really challenging political times. And I think, we have a lot to learn from each other in terms even of framing and bringing together different stakeholders. So I'm just grateful to be here.
Thank you, Jenny. Chris?
Oh. Well, I was just reflecting on what Jenny and others said about how we need to translate our science. And sometimes I regret what we've done in Singapore, in that our basic scientists feel horribly underfunded. And they all react very badly when in every grant, they're always asked about clinical implications and translatability. Perhaps you've gone too far, but I think that this is probably the only way to make sure that science is rapidly brought into practice. It's quite tough, though. And I fear we might lose some very good science because we're doing that.
Thank you, Chris. Alfred?
Thank you very much. I'd like to make my concluding remarks for this session around the issue of funding. Having been at the World Economic Forum with Claudio and had the conversations that are there, the way we frame our message around brain health matters to those funding agencies. And talking about Africa and the Global South in general, I think that we need to look into new funding mechanisms, and maybe philanthropy might be the way to go. Because when I take my continent, Africa, it's usually described as poor, but it's one of the richest continents in the world, with a lot of extractive industries and companies down there. And there is none of them does any philanthropic work. And if we build on that kind of approach and strategy, it would empower the communities, empower the brain workforce, because one thing I'm learning is that governments are the same everywhere. They don't pay much. They can support you with a rubber stamp, but they don't provide the euros or the Swiss franc very quickly, except with some few exceptions. So I'm thinking that if we begin to look in that direction, and as we work together in what we now call neurodiplomacy, we can translate it into neuroeconomics, and begin to put pressure on those companies to actually support brain health, and there are different aspects of it. I have tried personally with our teams to approach the richest African and to approach the richest French-speaking African, but they would like what we're doing, but they don't pay for anything. But if we get them around, but when I move around the continents, in the US, in Europe here, I see individuals who donate their wealth into building an Alzheimer's Institute. They donate their wealth and they have their name attached to it. Philanthropy is something we should look into, and then maybe do research around that. And then there are some new banks and funding mechanisms that are not strictly related to state-owned finances. That might be the way to go. Thank you.
Thank you very much, Alfred. As I said, it's now time to move on, and we'll have a couple of panels dedicated to national examples. Just a word of housekeeping, as we are running slightly out of time, we simply suggest that we make our break virtual, and that means that those of you who need to stretch their legs, walk, there is definitely enough space to do that, but there is also coffee and drinks available on the table out there. So feel free to stand up, stretch your legs, and grab something to drink as we carry on. And I'm pleased to hand over to you, Claudio, for first panel with Spanish colleagues.
Okay, so we are at the European Parliament, not the main building, Alfred. It looks better than this room. And actually, since we are at the European Parliament, it may be now time to give voice to the first country that belongs to the European Union. We have heard Norway, we have heard Cameroon, we have heard Switzerland, we have heard Canada, we have heard Singapore. Now, finally, we get to a EU state, and I'm honored and pleased to welcome Professor Mara Tiersen, President of the Spanish Brain Council. Great to have you. And Elvira Vacas Montero, President of the Spanish Epilepsy Federation and Vice President of the International Bureau for Epilepsy's European region. I would like to mention that is thanks to the epilepsy folks and the resilience and persistence of the epilepsy colleagues, mainly from the United States, that the IGAP was launched. So I would like to acknowledge this effort over decades. But now I would like to start with you, maybe Elvira or Mara, whoever wants to start, to talk about how Spain is approaching, the need or the interest of developing brain plans. Please, Mara.
So, first to say that in Spain we have quite a number of people affected by neurological and neuropsychiatric diseases, and we're talking about more than 24 million people, which means 43% of the country. And this is higher than other European countries, also because the longevity and the aging of the population is a big factor. And of course, we also realize that many of these disorders affect differently the two genders, the different genders, right? So females are more affected by, for example, depression, dementia, etc. So the economic cost in Spain has been calculated around 4.2, a little higher than other countries, also because the burden is higher. But if you count, this is just counting the healthcare cost, and I back up to the comments that were made before. If you take into account the loss of workforce, the disability burden, the carers burden that is mainly on females, at least in Spain, then it grows up to the 8% of the GDP. On the other side, I have to say that we are also, I appreciate very much what was said about the pediatric disorders. We have in our Spanish Brain Council a lot of representation of neuropediatric disorders. But we also need to take into account the developmental component of neurodegenerative or psychiatric disorders. So this is another component that is also present in our strategy, right? So this said, I have to say, and then I guess later on we can go more into detail into the Spanish brain plan. We have been working since I was president. I became president 2 years ago. We have been working on a Spanish brain plan, and we have it now ready. It will be presented on May 28th, and I can go into more details later. But what is positive, I think, is that the government is starting to recognize the importance of brain research and brain disorders. And there are 2 new centers launched in Spain. So the National Center for Neuroscience, Cajal Institute, that they have invested 70 million euros. And now they are launching the Neurotechnology Research Center. So I think this is, of course, if you compare this with the investment in new football camps, it's nothing, no? But still, I think it's important to acknowledge this. The other thing that I think it's important also is that the government is starting also to recognize the need of targeted policies. And last year in November, the law for the amyotrophic lateral sclerosis was launched. And this law will speed the recognition of disability, will ensure specialized medical care 24 hours per day, will help the carers, so will support the carers, and we can discuss how. And they also will establish a specific research center devoted to amyotrophic lateral sclerosis in the health system, right? So I think this is important, but I also think that we need, as we said, and we are doing this from the Spanish Brain Council, to acknowledge the fact that many of those disorders have common mechanisms, right? And it is important that we don't atomize the problem, because many of the mechanisms are common. So what we are doing, we brought together many patient organizations working for different diseases that have been working on national strategies, and now we are working on putting all these efforts together, see what didn't work, what worked, right? And not only that, we are also bringing together all the scientific societies, but also foundations, so for the public-private collaboration, right? We are embracing all these initiatives, for example, prospective cohort studies trying to find early signs of, for example, dementia, right? But also in the neurodevelopmental area, we have also the Neurorehabilitation Society for Neuropediatric Rehabilitation. And we also acknowledge the voice of patients. So we are trying, and we can discuss about our different objectives. We have 5 objectives. But all these things, I think, are helping us to acknowledge the multidimensional aspects of neurodegenerative, neurodevelopmental, neuropsychiatric disorders. But also something that is very important, and this was mainly brought by patient associations, is the chronic aspect, right? I don't know what happens in other countries, but in Spain, the health system is mainly caring for the acute phases and so on. For example, in neurodevelopmental disorders, there is no transition to adulthood. So there is no plan for that. So what we are now doing, we are working with the Ministry of Health, of course, that will be present in the launch of the National Brain Plan, but also with the Ministry of Science, Economy, also to explain how important is brain capital for productivity and industry also. And then we are also working with the social affairs, for sure. And we are doing this through a structure that is now new in Spain, that is called the National Office for Scientific Advisors. So we are working with all the different advisors to understand, and this comes to the funding issue, right? We are trying to understand what they are already doing and try to incorporate the view of brain health and brain disease in their policies and to make incidents, concrete incidents. So we are working with different working groups on all these different aspects. And I continue later.
Well, thank you very much. Lots of insights and also novelties, including the presentation on May 28th. Do we want to proceed with a second contribution from Spain?
Oh, yeah.
Or do we want to entertain questions? Maybe we listen to the second contribution.
Okay, good.
If you agree, and I took some notes, and then we would entertain some questions and discussion.
Yeah. But Elvira also will participate with IGAP in Spain.
Elvira, you want to make a statement or make some comments, or do you have a contribution you would like to give us on the topic? As you wish. So I've listed both of you, so
¿Prefieres que
would you like
ahora y
to?
luego tú? ¿Todo seguido? ¿O prefieres esto ahora? Sí, venga. So she will take over, and then I can explain a little more about the Spanish brain plan.
Please, please.
Ahora, ya, en rojo. Bueno, gracias por la invitación y por la oportunidad de hablar en español, que me desenvuelvo muchísimo mejor en mi idioma que en inglés, ¿no? Así que gracias por depositar esos recursos a mi disposición. Desde la perspectiva de España, la salud mental y la salud cerebral se han convertido en un reto urgente y prioritario, igual que en el resto de países de toda Europa y del mundo, diría yo. El envejecimiento de la población, el estrés, la pandemia y la falta de recursos especializados han acelerado la realidad que es evidente, ¿no? Los sistemas actuales no están preparados para ofrecer una respuesta equitativa, ágil y eficaz a estos desafíos. Además, la salud mental afecta de manera alarmante a la población joven y la edad laboral, condicionando su desarrollo personal, educativo y profesional, comprometiendo su futuro, y este impacto va mucho más allá del ámbito sanitario. La salud mental y cerebral tiene un enorme coste económico y social, afectando la productividad, el empleo y la cohesión social. A nivel nacional, quisiera destacar varios desafíos: las desigualdades en el acceso, los retrasos en diagnóstico y tratamiento, la inversión en investigación en epilepsia es muy limitada, 0,50 céntimos por persona al año, y la persistencia de estigmas y barreras sociales. Aunque España ha dado grandes pasos en salud mental y en enfermedades neurológicas, sigue faltando una estrategia integral que aborde la salud cerebral y mental en toda su dimensión y complejidad. Es urgente ese cambio de enfoque del que venimos hablando. La salud mental debe dejar de abordarse de forma aislada, ya que hablamos de un solo órgano. Debe entenderse como un derecho fundamental y una prioridad transversal en todas las políticas públicas. Después se va a tratar el tema del fomento de un ecosistema europeo de investigación e innovación, pero creo que quizás debamos ir un paso más allá, que no solo promueva la investigación, sino que recopile datos y buenas prácticas y que además incorpore de forma estructural la voz de las personas que conviven con estas condiciones en su gobernanza y toma de decisiones. Esto genera un espacio permanente de seguimiento y de evaluación a lo largo del tiempo. Es decir, es más sostenible a lo largo del tiempo. No creo que las personas que convivan con estos trastornos, de los que hoy estamos hablando, deban estar en el centro de nada. Deben estar sentados en la misma mesa, igual que hoy, impulsando el cambio. La salud mental y cerebral debe ser un compromiso político y social en toda Europa y no podemos permitirnos seguir mirando hacia otro lado.
Yes, I will translate. So thank you very much for the invitation and thank you for letting me address you in Spanish because I feel much more comfortable speaking Spanish than English. So from Spain's perspective, mental health and brain health have become an urgent and priority. The aging population, stress, the pandemic, and the lack of specialized resources have accelerated an obvious reality. The current systems are not ready to offer an equitable, agile, and effective response to these challenges. Additionally, mental health is having an alarming effect on the young and the people of working age. They are affecting their personal, educational, and professional development and compromising their future. The impact goes beyond the health sector. Mental and brain health have an enormous economic and social cost. They have an impact on productivity, employment, and social cohesion. At a national level, I would like to highlight the following challenges. There are inequalities in access to specialized care. There are delays in diagnosis and treatment. Investment in research is very limited, and in the case of epilepsy, it amounts to 0.5 cents per patient per year. And there are still lots of stigmas and social barriers that restrict and limit rights and participation. And although Spain has made huge progress in the field of mental health and neurological diseases, there is still no comprehensive strategy that addresses brain and mental health in all its dimensions and complexity. And we really need a change of approach. Mental health should no longer be addressed in isolation. We are talking about a single organ. It should be understood as a fundamental right, and it should have a cross-cutting priority. This should apply to all public policies. I would like also to mention that the European research and innovation ecosystem will be addressed later, I know, but perhaps we should go one step further. Perhaps the creation of a European Brain and Mental Health Institute is really important, but it should not only promote research, it should also collect data and good practices and should incorporate structurally the voice of people living with these conditions into governance and decision-making. This will generate a permanent space for monitoring and evaluating throughout time. And this would make it more sustainable as well. I don't believe that people living with these disorders, should be at the center of anything. They should be sitting at the same table. They should be helping drive change, and there is no other way to go about this. Mental health and brain health must be a political and social commitment across Europe. We cannot afford to continue looking the other way.
Thank you very much for the perfect translation and for the wonderful contribution. I suggest that you want to add something about maybe the 5 pillars of the Spanish plan that you already alluded to, so we are curious, please.
Yeah, if I can, thank you so much. So yeah, I will be concrete. Do we have time? Right? Good, fine. Then I
50,
will.
he said 50 minutes.
50?
50.
Oh, great.
Please,
Thank you.
please.
Okay, so yeah. So as I said before, what we are trying to do with the Spanish Brain Plan is, of course, not inventing things from scratch. There are many things out there. There are many recommendations for harmonization of policies, of strategies, etc. Right? So, because we have all these actors that are part of the Spanish Brain Council, these allow us to really bring all the expertise on the table. So the pillars. So the first one is to understand the situation. Because if we don't understand where we are, it's very difficult. And in Spain, we don't have registries, harmonized registries, unified registries. We don't have that. And this means that, for example, in Alzheimer's disease, many cases are not even there on the table, right? So we don't know them. Then and same happens with neurodevelopmental disorders, etc., right? So the first thing is to try to understand, to have these comprehensive databases, harmonized and curated databases, because one of the problems is also how we share the data, and the quality of the data is very important also. And now, for example, in EGA, that is a Spanish development, right? So we are working on how to share the data and harmonize the clinical databases, right? So the other important aspect is to understand and have evidence-based data on the social and economic impact of morbidity, mortality, the value of treatment, and this was inspired also by the EBC, I have to say. And to that, we sit at the table in the Spanish Brain Council, sociologists, economists, and people working in the health policies, right? So this is part of our strategy. And this we have started already, and we will also launch this report on that, by the way, is partially supported by a foundation, and also the Areces Foundation, and also the company Lilly. So the second aim is to support and boost basic and translational research. But as you were saying, yeah, you can ask for more funding, for sure, and we will, but this is probably not going to happen. Spain is still investing only less than 2% of the GDP. And in fact, if you look at the financial crisis, the expenditure in R&D has reduced, right? We are the second last country in investment in the OECD. So this will probably not happen, but other things can happen. For example, we need infrastructures, brain banks, right? And this is, as you said, grant independent, right? And in fact, we need to be there because those brain banks should be backed by brain donation campaigns, which are not there yet in my country at least, but also helping the banks to understand that they should also collect, for example, biofluids, plasma, CSF, antemortem, so that we can then translate it to biomarkers, the results that we have from the brains. Then there are other things like flexible funding models, contracts, streamlined contracting, no? And these shared resources across national networks, for example. The third one, and if you ask me then, I can elaborate a bit more. So for clinical trials, we need an administrative support. It's not just funding. Funding we have, but we need administrative support. And we need to include innovative schemes like single case, basket, umbrella trials, right? And if we could have access to the pharmaceutical trials that normally stop things if they are not statistically significant, then we could help subsets of patients also. So the other extremely important action is brain health, promoting brain health. And there we have collaboration, let's say multi-sectorial collaborations with the education ministry and so on. So we need to tackle the general population, schools, but also professionals, right? Because brain health, especially in primary care, is not well understood. It's not understood at all, in fact, in Spain at least. And there we have already, for example, next Monday, we have an event in the Senate. We have already more than 200 people attending in person and online to talk about brain health with also politicians and so on. And then we have other things happening in the next months. But then we also want to launch specialized initiatives. And for example, another good example of partnership with private foundations is the launch of a cohort study, a prospective cohort study to identify risk factors and lifestyle changes for Alzheimer's disease, right? And yeah, the last one, and I will be brief because I see that I'm extending too much, sorry about that, is to bring patients and patient organizations to get involved in co-creation, co-design. The problem is that we don't know how to do that. So the first thing that we will do is to bring to us initiatives that worked in other countries, right? And we will have this summer a course in the university for general practitioners, primary care personnel, but also scientists, etc., to try to learn how to do it, how to incorporate the views of the patients, because this is not obvious, no? And yeah, then of course, measures, social measures to reduce stigmatization. I mean, things that are already on the table in many other countries, right? And
thank you very much for presenting already some details on the plan, which will be launched in May.
Yeah.
I am aware that we are running a little bit late. I would still find it appropriate to maybe entertain 2 short questions, 2 short answers. Who want? We have an open discussion after everything. So we have 3 panels. Okay.
Intervention about the implementation IGAP in Spain.
Yes, just if you could give us a glimpse, and then we have to move on to Poland. So how do you implement IGAP? You want to say? Yeah, please.
Okay. Bueno, quiero recordar que el IGAP es el Plan de Acción Intersectorial sobre Epilepsia y otros trastornos neurológicos. Esto en otros países quizá no sea relevante, pero en España sí, porque como he dicho, ha habido muchas patologías neurológicas que han tenido avances, han tenido planes, estrategias, etcétera, pero la epilepsia es la históricamente olvidada y ha ocurrido igual en otros muchos países. En este sentido, tras la aprobación del plan, en octubre de 2023, se creó la Alianza por la Epilepsia en España, PI Alliance, que aglutina a varias sociedades científicas, a industria farmacéutica y a asociaciones de pacientes. Es liderado por la Federación Española de Epilepsia y nos propusimos implementar el IGAP a nivel nacional. Lo que hicimos fue crear una serie de reuniones para llegar a un consenso. Muchas veces lo más difícil es ponernos de acuerdo. La mayoría de las cosas no cuestan dinero, ¿vale? Conseguimos desgranar 22 subobjetivos y 60 líneas de acción concretas, acciones concretas con indicadores de evolución concretos y con agentes clave identificados concretos de cada acción para poder evaluar a lo largo del tiempo el progreso de la implementación del plan. Algunas acciones son muy sencillas, otras no tanto, pero sin duda ese consenso ha sido el mayor reto que hemos tenido. Destacar que tanto la OMS, WHO, como el Ministerio de España de Sanidad han estado informados al corriente y han sido invitados a todas las reuniones de trabajo que hemos tenido. Defender la participación de industria como un agente más ha sido un reto absoluto, pero sostengo que las relaciones transparentes son las que se tienen de forma pública, enfrente de todos, en la misma mesa. Como ha dicho también Claudio, en ocasiones el mayor desafío que estamos enfrentando cuando hay diversas partes interesadas es el coordinar todas esas partes interesadas. Por ejemplo, no es esencial que el Ministerio participe en todo esto. Es lo ideal, pero no es esencial. Por ejemplo, cuando se instala un protocolo de atención a las crisis urgentes, si lo consensúan 3 sociedades científicas, eso es ley en la práctica clínica. No necesitamos que el Ministerio lo apruebe de ninguna forma porque ha sido la sociedad civil quien se ha movilizado. Y para concluir, EPI Alliance es un movimiento de la sociedad civil, como decía, impulsado por las personas que conviven con epilepsia en España. Y podemos afirmar a día de hoy que España está implementando el Plan de Acción Intersectorial sobre Epilepsia y otros trastornos neurológicos.
To break down the acronym, EGAP is Intersectoral Action Plan on Epilepsy and Other Neurological Disorders. And epilepsy is the key word in here, especially for Spain, because it has been largely forgotten. Maybe this is not the case in other countries, but I know it is in many. So it is really important that at the end of October 2023, EPI Alliance was created, and the EPI Alliance is an umbrella structure under which different stakeholders, including the pharmaceutical companies, patient associations, come together towards the implementation of the IGAP in Spain, and in order to do so in an effective way, and perhaps with a different approach to the traditional one. So the important thing here and the most difficult thing is to come to an agreement, to reach consensus. And we have been able to single out 22 sub-objectives with more than 60 concrete lines of action. And in turn, each of these have key agents that were identified in order to be able to be accomplished. And we also defined clear indicators of evolution over time. It is important to note as well that the WHO and the Spanish Ministry of Health have been kept informed of the entire process. Another important aspect is that we need to defend the participation of the industry, and we thought this really pertinent. We considered it important to consider it another stakeholder to sit at the same table, just like the patients do. And this has also been a challenge for us, but I believe that transparency is what legitimizes this coordinated action. And as Claudio said before, the challenge is exactly that, to coordinate all stakeholders, to come up with a clear goal. However, although this is the ideal, it is not essential. I mean, to sit at the table with the Ministry of Health, for instance, because, for example, when a protocol for attending an urgent crisis is established between 3 scientific societies, this law, this becomes a law in clinical practice, and they don't need to get the approval from the ministry because it was the civil society itself that reached it. So to conclude, I would like to say that the EPI Alliance is a civil society movement. It is driven by people living with epilepsy in Spain. And we can say that today Spain is implementing these IGAP and other, the intersectoral action plan on epilepsy and other neurological disorders at a national level.
Thank you very much, Elvira. Thank you very much, Mara. We leave Spain and we move eastward. We go to northeast and we arrive in Poland, and we have 3 contributors that will tell us about the development of a Polish brain plan. And I would like to welcome Izabela de Sulavi Gladys, CEO and founder of the Mental Power Foundation, of a Mental Power Foundation, Professor Cezary Mazurek, head of the Digital Medicine Department in Poznan. He will tell us about, Izabela will tell us about patient organization and their role in developing brain plan. Then Professor Cezary Mazurek will tell us about the importance of technology and digital medicine in the new world that we are entering. And finally, Professor Konrad Rejdak is chair of department and president of the Polish Neurological Society. I would like to mention that Konrad organized recently a very successful meeting supported by the EAN in Warsaw, where we had the chance already to have a glimpse into what you do in Poland. But now the floor is yours. Who wants to start?
Okay, thank you. We are very, very grateful for your invitation and giving us opportunity to be here and present some of our activities. Indeed, this is very important for Poland to also build on your experience, your knowledge, and we are doing our best to also prepare a plan. Of course, many topics have been present in Poland over years, and I find many similarities to Spain, to Norway. Of course, now, being aware of Polish presidency, we need to really harmonize our activities, and we were giving from our government some guidelines to follow, and this is a special moment really to start act together to build such a plan. So let me just remind that our government gave some topics for presidency and priorities. So there are 7 pillars for safety in general, and among the 7, health issue is one very important. So they suggested that firstly, mental health of young people is a priority. Digital transformation of our healthcare system, which is especially important also to build databases, yes, collect data. We need to know much more about our patients, what happens. Of course, there are small databases across the country, but we need something which would be more universal and collect big data from the whole population. There is also big emphasis on prophylaxis and promotion of health in the society. So, of course, this is also fits very well to our plan, our agenda for neurological field. And lastly, drug safety. It's another very important topic. We know what happened during pandemics, that drugs were not delivered, and it was big problem for many chronic patients to get the drugs. So now we have a list of critical drugs that should be present in the system. Also, in big part, they should be produced or at least secured in our health system. So this is being done, and neurological group was asked to suggest such critical drugs. So for sure, anti-epileptic drugs or drugs for MS are very on the list. So this is a very important aspect. And of course, for us now is easier to adopt our activities to this general agenda designed by our government. We need to be aware that there are some programs initiated or in the process of development, prepared by different societies, but also very much supported by government. So we have rare diseases plan right now, and this is very important for us as neurologists, because of course 2/3 of rare diseases are related to neurological disorders. We have also a plan for elderly. So there is a governmental unit, the group to work on this plan. Here maybe we don't have such strong impact as neurologists, so we still negotiate to be involved more in this field. But at the moment we discuss Alzheimer's disease and in general dementia program for Poland. So it is in the process. there is a plan to involve GPs for screening of dementia patients, but we put a strong voice that the whole diagnostic process should be done by neurologists. Obviously, without that, we will not prepare well for upcoming treatments, yes, for dementia. So this is very hot topic right now in Poland. And also, Polish Neurological Society has done big work, so to identify our needs and some gaps. We produced a report getting data from our National Health Fund. So we made research on the current situation of neurological patients. We looked at different major fields in neurology. So it's important to send a message that Polish neurologists gave consultation or took care of 6 million people in a year, given year to 2023. So this is 16% of population. So our effort is really huge to, considering outpatient or hospital-based care. But neurology gets only 6% of general health fund in the society. So there is a clear disparity, and we need to at least convince our government they should increase funding for neurology. Of course, we are far behind cardiologists and oncologists. So this is the hot topic. We identified, of course, that we have increasing number of elderly patients. So we need to be aware of challenges as it happens in other countries in Europe. So and our staff, medical staff, is decreasing. We know that around 25–30% of neurologists are in retirement age. So this is big problem. If one day they say they want to stop working, we would have a huge crisis. So we really need to solve this issue. And also we found that research in neurological fields is much lower than in other fields. My colleague Cesare will tell us about it. So that was the basis, and really we are very, very grateful for big support from European Academy and Professor Elena Moro, Professor Bassetti, and Paul Boone, just to organize this summit, because it was a unique opportunity to bring together all the stakeholders, and it was major and probably the first such meeting to bring so many representatives from different fields. Normally we meet up in a very professional, narrow field like neurologists, and so patients, organizations were present. We had politicians, we had scientists. So that was really crucial to start this debate. We hope to continue this. But we had around 300 participants in person, but up to 1,000 online. So it was very well received, and we are very, very grateful for your presence at this meeting, because we had 3 vice ministers of health during our debate, so that was a great success to also bring them to our meeting. And this continues. So we managed to really establish discussion and present this data, and now we have some outcomes that they really consider this as a hot topic in the agenda, and yeah, equally important was the presence of patients' organizations. So maybe I can ask Isabella to continue, because yes, we had at least 3 major debates, but also several in parallel, more specific. But let me just conclude that we really needed this synergy to shift very specific discussions to a more general field, and it's been a great beginning. So thanks for your contribution. Isabella, maybe you can switch.
Yes. Okay. Thank you. First of all, thank you for inviting me for this very important event. It's a privilege for me to be a part of European Brain Council, and I try to be as active as I can. I'm representing non-governmental organization, and in Poland, generally speaking, the patient organization are very, very active, and they feel their power they have representing the patient voice. I give you a few examples. Just last year, under the Patient Ombudsman Office, I initiate to set up the specialized team of patient organization working on the brain area. We call this team as a team for the brain health, and we start act together. Now we've got 10 organizations working under this team on the Patient Ombudsman Office. And on the 20th of March, we organize in the Polish Parliament the exhibition on which we would like to especially build awareness about brain diseases, and also about the need of a holistic approach to brain health in the life course, as it was mentioned before by a colleague from EBC, from Claudio. And this is one example. Another one I would like to mention is that last year I ran the big survey in Poland, and we've got 1,025 responses. So it just the huge proof of Poland. Poles respond to this survey, and we would like to check the knowledge about the brain health and brain diseases among the Poles. And 40% declare pure knowledge about the brain and brain disorders, 30%. And yes, so that's why we prove that our main goals as a patient organization and NGOs is to build the awareness, because in this, when we build awareness about the brain diseases, we can prevent patients from stigma. I've got just few data from this survey, but I think it's quite interesting. Brain health is linked mostly to mental health. Mental health means for Poles good sleep and stress resilience. The vast majority of responders recognize stroke as a main neurological disorder, 80%. Recognize stroke as a neurological disorders. 70% recognize Alzheimer, 69 recognize schizophrenia, and 75 recognize depressions. But when they think about the about the brain health, they think about the mental part of our brain only. So I strongly think that we need to build understanding on the brain health is meaning exactly for each of us to well understand the challenges we've got, especially in the broader society, not only the neurological or psychiatric organization and professionals. And 40% of respondents admit that that they know somebody with neurological or psychiatric disorders. So in work, at home, or some some people with struggling with their brain disorders. And the most interesting for me is that 87% of Poles agreed that the prevention of brain health is equally than the treatment. But only 1/3 of them heard about the brain health hygiene, and only 13% understand what it means. So we've got a lot to do to teach not maybe only Poles, but we could be a representative of Europeans people living here, that we need to teach people from the beginning what the brain health is and how is the brain health prevention. And also I would like to mention that from my perspective, the neurology and as well as psychiatry, when we think about the brain disorders, is still undervalued in the public awareness and in the healthcare system, even though is responsible for treating a huge number of patients. As Professor Frédéric mentioned, we've got in Poland 6 million people with neurological diseases, not counting stroke patient. Only the stroke patient is 800 people in Poland suffer a stroke, and 1/3 not recover. And another data, more than 8 million people suffer from various psychiatric disorders in their lifetime. Treating brain diseases costs more than cardiovascular diseases, oncology, and diabetes. And we've got fragmented data because in Poland we don't have a general registry. So, we need to look at data from different sources, but altogether is nearly 15 million people suffer from some kind of brain disorder. So it's very important that brain health is addressed comprehensively as priority of national health policy and not just a sum of separate problems, neurological or psychiatric. And I mention again that integrated approach, it's not my idea, of course, I hear about it today and before, will allow for better organization of the healthcare system and more effective prevention effort. And prevention should focus on risk factors universal to many neurological and psychiatric diseases, the promotion of a healthy lifestyle.
I think you should move on, yeah.
Oh, okay.
Please come to a conclusion.
So the last thing I would like to inform you that we are on the eve of signing very important declaration in Poland. We establishing a brain health coalition. The founding members of the coalition are the Polish Neurological Society, because we cooperated very closely with Professor Frédéric before, and now thanks to he started this cooperation, we've got Polish Neurological Society signing this coalition, the Institute of Healthcare Management, as well the Polish Psychiatric Society, and representation from the NGOs and Mental Power Foundation, I'm pleased to represent, and other organizations will sign this, coalition at Friday, 21st of March. So we are really in the eve. And then we aim to prepare the brain health strategy for Poland, all together working on this document till the end of this year. We would like to done it, and 2026 will be focused to approve this document by the government. Thank you so much.
Thank you to Konrad and to Isabella. I think we have the last contribution. As a Swiss, I have to look at the clock. So, and I took the clock when it was delayed, but I will look that we don't take any further delay. So please,
yes,
after this introduction, yes, please take your 10 minutes.
I will try to be composed. So first of all, many things happened since we met first time with brain health partnership idea and strategic research and innovation idea and agenda. We were presented in November in Brussels here, thanks to organizing this by Polish Academy of Sciences office here. And because Poland were quite active in European funding projects since even pre-accession time, we found that we were never active in any research field funded from European funds corresponding to brain. Human Brain Project and following projects were never had the Polish partners. So we started to explore this, why? And we joined immediately last year, recent year, eBrains Association as a full member to try to build awareness in Poland about the digital role or digital tools role in the brain research, in the brain health. Fortunately, there was strong interest, and we formulated in January this year the consortium of 19 partners, 19 partners, who wanted to contribute to build a Polish eBrains node or eBrains PL infrastructure. We submitted the proposal to Polish roadmap for research infrastructures, which we actually are now waiting for the results of. And we started to explore what is the advantage, actually, what is the advantage digital technologies can bring to research and brain health. And there are many voices. We actually made also a survey how many digital projects are among those institutions. Half of them were mainly focused on basic research, not many applied research, not many deployments. Tools and services were just few projects, a couple of projects. Less than 10% of the project provided the open access, open data as the results of those projects. So we found that there's a strong challenge for us. And we started to talk with our ministries about the strategy, especially that we have also in November, we had an announcement about the digital strategy for Poland. And one of the Polish challenge for 2035 is to have at least 100 diseases diagnosed with AI, with the help of AI, which means comparing to the burden of the neurological diseases, half of them should be neural-based diseases at least. So we try to explain this, how we can harmonize and build a synergy among many different areas and activities. And first of all, we need to have a data focus, data and services focus. That's what we are doing with eBrains, which it seems to be the infrastructure for servicing not only scientists in Europe, but also in Poland, with respect to common European data spaces, which is another synergy field, because we need to find out the way to make the synergy with Ministry for Health, which is corresponding to common European data spaces. And we have Ministry for Research and Science. So this is the challenge. But the real challenge is to tackle the brain challenges. The brain challenges, which are, for me as a computer scientist, were corresponding to understanding the structure of the brain. And now the challenge for the future is to understand how the structure is involved to functional aspects of the brain, how these functional aspects of the brain are represented by individual part of structure. And this is the challenge for computing, because we talk about different scales. We have a central nervous system, which is resolution of 1 meter, And we have the ion channels, which have the resolution of picometers. And we have a whole spread of data to understand why ion channels are corresponding to particular diseases, or how the communication on neuron systems, which is 1 centimeter, is involving particular neurons or cells, which we have trillions of them, or hundreds of trillions of them in our body, in our brain. This is all about multi-scale simulation and multi-scale computing. And we know those models from the weather forecasting or other areas where computing is involved, but it's the challenge to simulate or to model this for the brain, to understand actually individual features or elements or the mechanisms in the brain, how they contribute to the overall cognitive function of the brain, and which of them are contributing to the cognitive functions of the brain. So that's why we make a synergy with other investments we have already in Poland. Poland invested 50 million euro in the AI factories, and we were announced to have AI factory actually in our center in Poznań. We invested also, we co-invested with EuroHPC in the quantum computing. When we talk about picometers, the quantum mechanism is already there. So we may get something more having quantum computers as a basement for those simulations. And we have to unleash the power of AI for healthcare. There's almost the end of the day, nobody talk about ChatGPT, but the day is lost when we don't tell about ChatGPT. But I will not tell about ChatGPT. I need to tell about the AI for healthcare, AI which is understood as the tool to address the patient journey, because the health is the state, continuous state. And we cannot look for the AI only for the future to analyze the snapshot of one-time brain image or RMI or CT scan and understand what happens in our brain. We need to have the AI tools for to support the whole patient journey and understand from the prophylaxis to up to the quality of life after the therapy, how we can help the patient or the doctors, or how we can prevent the disease. So in general, I wanted to be short, but I cannot be very short when I'm starting to talk about my future challenge. But the thing is that we have today's medicine. We are thinking about them, those tools, digital tools, as being not only preventive or predictive, but also prescriptive. So having the idea and being aware what are the mechanisms for the disease development, we are able with AI to propose the right therapy for individual patients. And this is really a challenge. That's why we try to bring to the implementation plan and brain health strategy in Poland the whole digital platform tools, and also understanding how digital tools can support not only researchers, but also patients. We talk about future patients, which are 30 years old, and 30 years old people don't need to understand digital technologies because they are living in the digital technologies. So we have to understand how to help patients with digital technologies to be healthier in 20 years.
Great.
Maybe that's
Thank you very much. Also to Professor Cezary Mazurek, after 31 minutes Spain, 29 minutes Poland, we come to an end of these two contributions, and I hand over in time to Fred Destrebecq. Please, Fred. Thank you for your great contributions. We'll come back in the discussion with specific questions.
Thank you very much, Claudio. It's now time to turn to Nordic countries. We had a snapshot about the Norwegian brain plan a few minutes ago, but we are extending our geographical outreach by inviting representatives of Denmark and Finland. So we are having with us Morten Lorentzen, Director of the Danish Brain Council. Welcome, Morten. And Mika Martikainen,
who is the chair of the Finnish Brain Council. Mika, I'll probably start with you. You had some comments and contributions after hearing from colleagues from other countries. So how does that resonate with the way by which Finland developed the national brain plan, and where are you at the moment, so that we can actually see how it articulates with what we heard from other colleagues? Over to you.
Okay, so thanks for the very kind invitation again to this meeting, and it's been really a pleasure and a privilege to listen to all the presentations of the day, and looking forward to obviously to all the others that are still to come and all the discussion. Just to give a little background on where we are in Finland. So some of you might know that we have actually in Finland already a long tradition of public health projects that that have been in some ways successful and in some ways pioneering on bringing health benefits to the whole population. So the prime examples probably are the North Karelia project that was tackling the high CVD mortality in the particularly northeastern parts of Finland decades ago, and with massive success bringing down the CVD mortality in those parts of the country, and then obviously extended elsewhere as well. Another good example is the Finger project that was brought up already previously today. So the first time when it was shown that with a population-based approach and fairly simple lifestyle modifications, you can really affect the cognitive and memory problem in the population. So that with focused interventions on modifiable risk factors, with diet changes, with exercise, you can affect the risk of memory decline in both patients who have no known genetic or family risk factors for cognitive disorders, and also those without. And this, as we heard, has been extended already to many other countries and modified further, and so forth. So we have sort of the tradition of this sort of approaches. In Finland, the organization of people currently involved in the Finnish Brain Health Initiative are the Finnish Brain Council, which is sort of an umbrella organization that I'm representing here today. We have several professional organizations, for instance, the Finnish Neurological Society, Finnish Psychiatric Society. We have other scientific organizations involved, and we have also several neurological and psychiatric patient organizations involved, and all share the interest of improving diagnostics, improving care, and improving prevention of brain disorders. We also have taken on board Neurocenter Finland. That is an organization with all the universities with medical faculties and the university hospitals in Finland. Originally, Neurocenter Finland has been primarily promoting neuroscience research in Finland, getting more finance to neuroscience, and improving, facilitating collaboration and new collaboration within the country and also abroad in the field of neuroscience. And I think now when we have both Neurocenter Finland and the Finnish Brain Council on board, so I think this broadens the approach we have and brings together, as we've heard before today, both the research base, which I think is crucial for improving brain health, and also the contributions of patient organizations and the professions involved. So the early parts of the current project were launched by a member organization of the Finnish Brain Council, and these have been focusing on a few, I would say, primordial prevention approaches. So very early approaches, very broad population-based, improving knowledge and understanding about the importance of good sleep, about brain healthy working life, and things like this. But now we are broadening the approach and definitely taking on board more also the sort of traditional disease oriented and medical care oriented approaches in discussions within the Finnish Brain Council. We have good understanding together that we even though the population-based approach and going to the healthy general population, increasing knowledge about importance of brain health, protecting your brain and stuff like this. This is very important. This is definitely needed. We need to go to things like this, but we cannot forget the patients. Very good comments today earlier about, for instance, epilepsy patients. We all know the stigma related to neurological and psychiatric conditions. We know that in many countries there is a shortage of neurologists. There is difficulty of getting access to quality neurological care, also to quality psychiatric care. So improving care pathways, improving access both to primary care, also access to specialist care. These are very important things, and these we are trying to address in several ways. Trying to gain access to politicians and decision makers. Unfortunately, in Finland, we are not as wealthy as our colleagues in Switzerland or Norway, and we all know the current struggles of finances and the challenges with the current geopolitical situation that requires funding elsewhere. We all know the challenges related to aging populations. Declining birth rate, which is also, as in Singapore, is a major concern also for us in Finland. Actually, that the birth rates have been really plummeting. No one really knows why. There are several thoughts around, but if someone would give me a definite answer, I would be glad to hear. But to make this short, so there are lots of challenges, and I think we need the money, but it's very important also to look at things that can be done without that much external funding and extra funding, to do things in a more smart way and to do things that are particularly in the prevention side that are not so expensive. Also, a very good point by Frédéric earlier, that we have to keep in mind and also keep telling the politicians that good early care is very useful, and it's also financially sound approach. When we treat patients, for instance, with MS early, when we treat acute stroke early, we all know that this, in the end, it saves money. It saves a lot of money if we can keep people in working life, if we can keep them healthy and without external need of external assistance and so forth. So this is very important. I don't know if I've gone already over time. I'll stop here, and if there are questions, I'm happy to answer. Thank you.
Thank you very much, Mikael. Morten, I'd like to turn to you, as the Danish Brain Council is a relatively new kid on the block. Just to understand, the process for your creation, and since you have been, let's say, in charge of the activities of the council, where you stand and when can we expect a Danish brain plan?
Oh, thank you, Frédéric, and thank you for inviting us as the new kid on the block. It's only 8 months ago we managed to establish the Danish Brain Council. For many years, we've been looking very enviously to Norway and to see how they got the Brain Council together. And while I personally have been trying to make this happen for a few years, and in the preparation of making it happen, we had tremendous impact by knowing the Norwegians and the willingness of the Norwegians to share their processes, what one should not do, and what one should do in order to make a brain council happen. Like in many other countries, we've heard it today, Denmark is also an extreme siloed environment. And it's also focusing on the three perceived major areas like cancer, cardiovascular, and diabetes. That's basically where the focus and where the perception by the public and the politicians has been for many, many years. We managed to get the Danish Brain Council going, and in relatively few months, 6 to 7 months, we are now 33 member organizations of the Danish Brain Council, and that consists of patient organizations, professional societies, researchers, and treatment centers. So we think that is a testament to the fact that we are needed. There is a need for an umbrella organization that can not only be a megaphone for each members, but also find out exactly what are the common things that we have together and where are the gaps. Now, very importantly, at the same time we were established, there was a research from the University of Aarhus that actually took on a study funded by a foundation as to what is the brain diseases in Denmark actually, what does it cost, how many are affected, and not surprisingly to us, but to the public, very surprisingly, they found out that about 1/3 of the Danish population is directly affected by a brain disease. Now that's a lot, and it's growing. The other thing they found out was that 25% of all money spent within the healthcare and the health system is related to brain diseases. 25%. And that equivalent 8 billion euros. If you put on the indirect costs and combine those two, it's about 8% of the BNP, like in your country. 8%. Now, why is this important? Well, with these numbers in our hands, we are capable of putting the health or brain health on the agenda. We can put it on the agenda for the politicians. There's only one thing, from what I know, that politicians really care about, and that's numbers. Whether it's election numbers to remain in the seat or numbers for cost. That is something it is important. So I can, for those who do not have these kind of numbers available, I can strongly encourage you to make them available somehow, because they matter. And they also matter in the public knowledge. Now, like I started to talk about is the fact that the perception in the Danish population is that cancer, cardiovascular, and diabetes are the most important things that we need to worry about. And I'm not saying that we shouldn't worry about those, but there are one organ, one place where it all depends, like you said. And that's the brain. And last but not least, we also managed to get the eyes and the ears of the media. Because this is also something that is so important. If we want to change something, we need to change the perception from the media as well. That's not an easy one, but with these kind of studies from a respected university, then we are really capable of making them aware that we're there. Now, it is early days. For us, we need to keep focusing on the fundamentals. And in order to be able to navigate towards a lighthouse, like a brain plan, that for us is a major lighthouse. In order for us to navigate the right course, we need to understand where we are today. And in spite of the fact that we have multiple databases and registries, we are not really capable of giving a precise measurement about where we are with all the 25 different diagnoses. So we've started a work also funded by a foundation in order to find out where we are on all these diagnoses. Not only comparable within Denmark, but also to countries that we normally compare ourselves to. Now that work is so important because otherwise we'll just navigate in the blind. And the lighthouse for us is a brain plan. We are looking very much forward to present that in hopefully a few years' time, because that will take time to make this happen. But along the way, we will not be silent. We will be active. We'll work on the politicians. We'll work on the media. We'll work on the general public. So, yeah, with that, it's back to you.
Okay, thank you, Morten. So Henrik, no pressure, but Morten is calling your lighthouse. I had in mind a North Star, in a sense. But it's probably over to you, maybe to resonate a bit with the experience from Finland and Denmark. And I'm tempted to ask you immediately, is it just an issue of funding?
No, it isn't. First of all, I have to congratulate Morten on establishing the Danish Brain Council. And I'm super happy that our closest neighbor finally has a Brain Council. And we will have a tight collaboration for the years to come, I'm sure. And we can already feel you breathing our necks, gaining 30 members in such a short time. So fantastic, fantastic. Congratulations. I talked earlier on about finding the priorities within the strategies, because I think when we're talking about the brain health strategies, we have to fill the gaps between other strategies, as we said. There's a lot of good initiatives in different strategies, but we have to find what has to be prioritized within the brain health strategies. And you asked me to have some thoughts about what's happening in other countries. And I would like to say that when we're talking about prevention, we have learned something from Finland, because one of your colleagues were in the Directorate of Health presenting how you're working on dividing the population into different subgroups to find the best or the biggest prevention factors for different subgroups in the population. And I think that's a very clever way to go about when we're talking about prevention. We know what's on society level prevents, for example, dementia, but we need to know more about what is the biggest prevention possibility for all the brain diseases in different groups of the society. So this is one thing we're trying to implement in our new brain health strategy. And also from Spain, you mentioned the chronicle perspective or the perspective of the chronic disease. And that reminded me of something else, that we have asked our patient representatives on where are the biggest problems related to healthcare services. And we can find that a lot of our patient representatives, they tell us that it's early on and late in the pathways. When you have a diagnosis and you get your treatment in the special healthcare systems, things are mostly fine in Norway. But it's the time from symptoms till There's a lot of noise here. I don't know.
Yeah, no, sorry. It's we are testing because we have a WebEx in the session right after.
Okay.
So is it
I will
just
try
possible
to ignore it.
to okay?
No problem. But early on, from symptoms till diagnose, it's a problematic part of the patient pathways. And on the other hand, the follow-up after being released from hospital, so to say, are also a phase that a lot of patients report troubles. And I think in the brain strategy perspective, I think these are two phases of the pathways that we have to look for similarities. So one action point that we would like to have in the Norwegian brain health strategy is actually mapping out the causes of diagnostic delays related to brain disease, to find if there's similarities that we can work on. So we don't have to always work, as I've said many times before, diagnose specific every time. And on the other hand, what is actually the similarity in burden across the different brain diseases? And last, I would like to say something about research, which a lot of you have been mentioning today. And I totally agree about what's been said about infrastructure and national brain biobanks. That's also initiatives that we really hope to succeed with in Norway. And the last point here is trying to work more or get more out of the resources that we already have. We have a lot of excellent research institutions in Norway, but they don't often work together. And this, I will say, is one elephant in the room that we have to address when we're talking to researchers. We can get more out of the research if we start working closer together. So we are also rooting for establishment of more national research networks that the next step would be could collaborate even better with other countries. Yeah. So that is some concluding remarks from me. Thank you very much.
Thanks a lot, Henrik. And I guess you're providing a fantastic segue for last panel, and potentially there is a reflection to be had there. I just wanted to ask you if those elements were constitutive of your strategy 2.0. Is that how you managed to move that needle forward, as we were saying earlier?
Yeah, all of the points I've talked about now are actually in the draft for the next brain health strategy. So, but it's the Directorate of Health that has been writing it together with us and a lot of other contributors. And now we're hoping that the Department of Health is actually going to put their stamp on the strategy with this content.
Okay, fantastic. Let us know when it comes and if there is any support that you need. Morten, Mika, is there any last word you'd like to exchange? We have like 2 more minutes before we move to our next speaker. Morten?
No, I was just intrigued by one comment earlier on that there is a tendency to forget the youth, the young people. They are really having a struggling time. We don't know really why, but we know the consequences of this, because they're looking into, because of their not being well or well-being is under pressure. They're looking into different kind of diseases, being depression, anxiety, isolation, not being part of a group, not having relations. I think this is a slow-moving tsunami that is coming to the western part of the world, and probably also in other areas. But for us and for me, it's extremely important that we look into this and that we try to focus on it, because otherwise we are in deep water. Thank you.
Thank you, Morten. Mika?
Yes, I have to say I couldn't agree more with that. So, but in relation to this and obviously other things, so I think it's very important that has been brought up in many comments earlier, so that we keep on developing the science basis to what we are doing. So I think it's extremely important that we develop the evidence-based and science-based approaches and try to develop also to gather data on what approaches are what are most cost effective and what are most useful in getting benefit for the input we are doing, because we're working with limited and limited finances and other resources. So it's very important to also gain more understanding about this, which is sometimes difficult when we are talking about prevention. But anyway, we need to work on this.
Thank you. Henrik, any last words?
No, I've said enough, I think.
Okay, thank you.
Thank you very much.
So please join me in thanking our three panelists. We now move to our next session. We continue on navigation with national examples or initiatives, and we stay actually in Nordic countries in Denmark, as we are welcoming Karin Hamburg, who is Senior Vice President and Chief Medical Officer at Lundbeck in Copenhagen in Denmark. And Karin is with us via WebEx in order to present public-private partnership in Denmark called the Lighthouse Life Science. Karin, it's a pleasure to have you, a real honor. Thank you for making it, and sorry we are slightly behind schedule. Thanks for your patience, but we'd like to give you the floor for this presentation. So over to you.
Thank you very much, Fred, and thank you for this nice introduction. I'm joining you today to present the Lighthouse Life Science, which is in this particular period focused on mental health and therefore also relevant for the activities of this meeting. I'm honored to have the opportunity to present at this meeting, and obviously I would have been delighted to also join you in the room. Unfortunately, this was not possible. But I hope that with this presentation, I can give you an impression of how the Lighthouse Life Science is an example of a collaborative, multi-stakeholder approach that supports mental health and therefore also brain health. So if I can ask for the next slide, please. So this slide will be no surprise to the people in this room that the situation on mental health in Denmark is similar to what we see in many other countries. It is an increasing public health challenge. And I just heard the previous speakers also mention that this is not only a challenge in the growing elderly population, but clearly also in the younger population. And there is a significant increase in poor mental health among young people as well. So in general, an increased prevalence and also more chronic diseases and comorbidities in this specific population. So unfortunately, we're also faced with some social inequalities in mental health. We all know that people live shorter lives and they are at a disadvantage in some specific social situation and at the work market. So that is clearly a big challenge. So is the challenge on resources in the healthcare system and also at the local environment in the municipalities, that there is a resource gap that we eventually will need to fill to solve this challenge. So next slide, please. So a little bit about the concept of Lighthouse Life Science. The Lighthouse is a public-private partnership, and it builds on addressing challenges, complex challenges in the healthcare sectors. And again, as I just mentioned, the healthcare sector in Denmark is under a huge pressure, so that is clearly a challenging place to be. It does develop and implement solutions in collaborations with patients and also with employees in the healthcare system and citizens in general. So the whole setup is based on supporting equality in health and also to develop the competences needed among the partners so that we can progress solutions in collaboration for scaling, positioning, scaling both nationally but also internationally in this sense. It is very, very evidence-based, so that has been a key prerequisite throughout the Lighthouse for this particular period of mental health focus, that we have put a strong focus on initiatives and solutions being evidence-based, hopefully with the ambition to scale them later on and to facilitate that with the basing this on an evidence-based approach. So if I can ask for the next slide, please. A little bit more on the setup and how this initiative actually was initiated. So this is based on an initiative initially from the Ministry of Industry, Business Affairs and Financial Affairs in Denmark to ensure growth and welfare after COVID-19. So that was the start of the Lighthouse. It has had a primary phase focused on healthy weight, and the current phase is a 3-year phase focusing on mental health. There is still a strong growth factor, but also increasingly a collaboration, a very close collaboration with the Ministry of Interior and Health in Denmark. So basically the Lighthouse right now stands on 2 legs. One is a growth initiative focused on supporting small and mid-sized pharma companies and digital innovative companies to grow and create solutions of benefit for society, but also to deal with health issues like the ones I just mentioned. The initiative is facilitated by the Danish Life Cycle Cluster, and they are the ones setting up the partnership, governing the pilot projects and driving the platform, as I will come back to in a few minutes. The initiative will run until 2030, but as I mentioned, we are now in the middle of the mental health focus area for the Lighthouse, and in total this will run for a period of 3 years. Next slide, please. This is to give you a bit of a flavor of some of the partners that are part of the Lighthouse, and there are many partners. In total, more than 300 partners have joined the collaboration, and it's also a collaborative governance model that you can see to the right of this slide. So the funding that was provided by the Ministry of Financial Affairs, of Industry, Business and Financial Affairs, was about 10 million euro for this initiative over this period. And that is cascaded into grant structures supporting mental health initiatives as we speak. The organization is set up in a way that there is a steering committee advised by an advisory board. That advisory board is pretty broad and also include patient advisors, whereas the main consortium is supported by a panel of experts with specific substance matter expertise in mental health to be able to guide on the selection of grantees that will be offered grants as part of the Lighthouse initiative. So if I look across this broad variety of partners, I would say that this is really a wide span of partners from municipalities, regional hospitals, universities, private companies, and foundations. And in general, it sort of combines, to put it in short, those that own the problems with those that potentially own some of the solutions. So that is what the partnership is about. Next slide, please. The concept of the Lighthouse is built on a growth platform, and as I'm sure you are aware, over a 3-year period, there is a limit to what one can achieve. But there clearly is, it takes a starting point in a needs assessment. And as I started out saying, those that own the problem also defines the need and are part of qualifying that need for some of the solutions that will come about. The platform supports basically communication, needs assessment, but also a matchmaking, again, between the needs and between the solutions. A lot of this is based on smaller, innovative digital solutions that can take different forms and shapes, but they are basically either substituting for human resources in the healthcare sector, or they are bringing about solutions for treatment based on digital or AI initiatives. So quite an inspiring variety of initiative. The platform supports legal advice. It supports like innovation, training, education, and also competences related to national and international procurement and scaling. So a wide variety of advisors supporting this based on a needs assessment and a matchmaking exercise. And again, the selection is supported by an expert panel that selects the projects that will move forward as signature projects, again, based on a strong expectation of evidence-based solutions. So next slide, please. Again, we are in the second phase of the mental health period of the Lighthouse, and we decided early on to take a very close anchoring, or to anchor this initiative closer to political initiatives and priorities. So what we decided was to anchor this in the 10-year psychiatry plan, which is a plan authored by the Danish health authorities and recommended to the Ministry of Interior and Health in Denmark. And that plan is based on solid research that has been carried out over a number of years, and the plan itself has received public funding in 2024, above 50 million euro, and again of €500 million granted to fund that plan towards 2030. So it has been important for us to anchor this with political willingness to invest and the broad political support for mental health. And we believe that by doing that, we have received much larger traction of this initiative, and also been able to showcase that public-private partnerships like this one can make a difference in terms of supporting mental health initiatives. Next slide, please. To dig a little bit deeper in the 10-year plan for psychiatry and mental health, the plan is a comprehensive document, and it brings up 39 initiatives for priorities in Denmark to be leveraged for increased mental health. We have selected among the top 5 priorities these 5 initiatives, and predominantly the first 3. So the focus for the grant structure in the Lighthouse has been, number 1, the easily accessible high-quality services in municipalities for children and young people. Again, speaking back to the comment that was made earlier, that this is a particular problem that we see, also a growing problem, and a rapidly growing problem, unfortunately. There is also, at sort of the other end of the scale, a focus in our grants on strengthened treatment and care for people with severe mental disorders. So that is sort of, again, more speaking to the severe end of mental disorders that we leverage for this specific initiative, and a lot of focus on that as well. And then last but not least, the information and anti-stigmatization of mental disorders, for example, by working together with workplaces, trying to also engage the workplaces in some of the initiatives as test partners, etc., has been also part of the initiative of getting partners to work together. Number 4 and 5, obviously the strengthened multidisciplinary and evidence-based environment is a fundamental part of the Lighthouse initiatives as such. And the framework for research and prevention of treatment of mental disorder is not so much addressed by the Lighthouse, but obviously a very strong component of what needs to happen to address mental health challenges in general. So again, part of the fundamental prerequisites for this to work out. And next slide, please. So some of the drivers, again, for sustainable success within this Lighthouse initiative have been the dual focus. The dual focus is really on the 2 legs, enhancing mental health, but also on driving economic growth for some of the smaller SMB companies that have engaged in this and who are struggling to make their solutions applicable to the partners that they would otherwise be faced with. There are many hurdles for some of these initiatives. Can be technical hurdles, language barriers, it can be procurement hurdles, and that's where they can get support and get partnerships together with the Lighthouse initiative. For the part on mental health, obviously, this is a reinforcement of some of the national and international commitments to mental health. And again, we have found a basis of aligning very closely with political priorities to leverage the Danish 10-year plan for mental health and psychiatry, and to base this on evidence-based support. We also work very closely with the Danish life science cluster that is managing the platform to ensure that we have measurable progress of initiatives and projects. And that means in terms of progressive value generation and small value steps on a value ladder that we have created as part of this initiative. And next slide, please. So obviously I'm here in my capacity predominantly of being the chairperson of the Lighthouse main consortium, but I'm also part of Lundbeck and I have this role as Chief Medical Officer and Senior Vice President in Safety. So why is Lundbeck in the Lighthouse Life Science? A lot of people would ask. And that is clearly because we see it as an obligation. We see a potential in us contributing with our scientific expertise, and not least with our commitment and expertise within brain health. So other companies, of course, do that, but we are, to my knowledge at least, the only company of our size that has a sole focus on this. And this is our life and breathing every day. We're also in this to be part of showcasing our national capabilities to innovate, so to support innovation, to create networks, as well as to showcase the healthcare and life science sector, both at the national but also at the international level, including our ability in Denmark to form public-private partnerships. And by now, we have attracted attention from at least 15 countries who are curious to know more about this model and to implement this also beyond mental health, for example, for rare diseases, chronic diseases. So the model as such is scalable and can be used also in other settings. And then together with you, I'm honored to be here and have the opportunity to also be part of working together with an organization like the European Brain Council and the national brain councils that I very much support in putting mental health and psychiatric diseases and neurological diseases high on the public health agenda for the benefit of patients. So with this, we can move to the next slide, and that concludes my presentation on the Lighthouse Life Science and the period on mental health. And I would like to sincerely thank you for listening, and also wish you a very productive and nice and constructive meeting going forward. Thank you for inviting me.
Thank you very much, Karin, and we are equally happy to be working with you and colleagues at Lundbeck. And I trust that after your presentation, you'll have many more countries knocking at your door to learn about the model.
That would be wonderful.
And we are also committed in exploring how we can scale that at a European level, particularly as we are currently discussing the future framework program for research and innovation. And we are still in a period of time where we can be creative as to how we can spend the reminders of the current budgets. So we will definitely take on our host of today, but also his colleagues within the Parliament, as well as members of the Commission, to explore this. And Karin, thank you also, because you're offering a perfect transition to the last panel on our agenda this afternoon. It's a panel where we wanted to address the issues of research and innovation, but also that we entitled around the emergence of an ecosystem in brain health and brain research. It was provocative on purpose, and I'll explain why in a moment. But I'm glad to introduce Thomas Ryan in this panel. So Thomas, you are board member of EBC, but also the chair of the advocacy committee at FENS, the Federation of European Neuroscience Societies. We also have with us Agnese Catanao. Agnese, you are the chief medical officer at Angelini Pharma. And we also have with us Jan Shadrack. Jan, you are the therapeutic area head for neuroscience and rare disease at Roche. So welcome to each and every one of you. We just heard from all previous speakers, but also from Karin about the challenges, but also the many developments in the space around brain research. I'd like to mention just one, the European Partnership for Brain Health that is coming in a few months, starting in January 2026. It's going to be really seminal in the first milestone in terms of putting brain health on the policy map, but also in the research area. It's, of course, not a silver bullet, but it's the opportunity to connect to it many different initiatives. Why not a European Lighthouse, but why not plenty of other areas? Thomas, I'd like to start with you with an introduction as you're a basic neuroscientist. Maybe you can lead us through a couple of the key points, the key challenges that you can see from the brain science community at the European level. And maybe we can then move the discussion to colleagues from the industry as well and open then the discussion. Over to you.
So, okay, good afternoon, everyone. So as Frédéric mentioned, I'm wearing a number of hats here. So I'm a board member of the European Brain Council. I'm also chair of the FENS Advocacy Committee for the Federation of European Neuroscience Societies. And I'm also the European member of the American Society for Neuroscience, Government and Public Affairs Committee. That's when I'm not doing my normal job as a professor at Trinity College Dublin in Ireland, primarily engaged in research. In this forum, I'm primarily representing FENS, and FENS represents about 25,000 active research neuroscientists throughout Europe and also affiliated countries. And just jumping off from what Fred said about the European Brain Health Partnership, I do think we can consider this a lighthouse for focusing on how the brain research ecosystem can be developed within Europe. But I think there are significant challenges there, and I also think there's been a certain amount of defeatism that I've heard today with respect to the issues of how we can get increased funding for brain health and for brain research in Europe. And if I can, since I can't use slides, I will talk about the 3 C's, which I think are important here. And one is we need catalytic investment, which is what the European Brain Health Partnership is, but I say catalytic, not comprehensive. We need a broad coalition. And thirdly, the most important word here today, I think, needs to be competitiveness. The only way that we're going to advance brain research in Europe is with a focus on competitiveness. We need to echo the Draghi report and the Heiter report to make Europe competitive in the research space in the coming 5 to 10 years. Because if we don't, we will cede ground not only to the USA, but to China. And also because of the truism that the brain is the most complex object known to man in the known universe, and therefore we can only progress scientifically with a view to it being incredibly competitive, because that's what science is. Now, the issue is that brain disorders account for over 1 trillion euro of expenditure in Europe per year. That's for the 500 million people who live here. The European Union is spending about 500 million euro on brain research per year. Now, that's at a federal level. We don't know how much each member state is spending on brain research because no one has quantified that. But we do know how much we're spending in total on biomedical research in general. And it's about a third of what the US spends, roughly. And this we don't think is good enough. And just to emphasize how this affects relation to health, because we talk a lot about health, I think this is a much broader issue than health. But just speaking about health right now, we know that health expenditure in the European Union as a percentage of GDP has increased steadily from about 8.5% in the year 2000 to currently about 11% of GDP. This is across the European Union. In contrast, on research and development in general, so not just biomedical research, but all R&D, we're currently spending about 2% on R&D of our GDP, and back in the year 2000, it was about 1.5%. So even the rate of increase is not keeping up with our expenditure on health. So we think this is a problem. And if we look currently across countries, not across time, but across space, gross domestic expenditure on research and development, Europe is on average spending about 2%. There are some very good players nationally, like Belgium and Austria, who are keeping up with the USA, spending about 3.5% of their GDP on research. Israel spends 6%. Japan spends about 3.5%. But in general, European countries are not keeping up, and the European Union certainly is not keeping up. This is evidenced, I think, not just by the investment in research, but the products of research. The major funder of products and benefits of research, the major funder of biomedical research globally is the US National Institute of Health, funding multiples of the investment of the European Commission, the Canadian Health Institute of Research, and the Australian National Health and Medical Research Council combined. And if you are to look at the outputs of this, it's quite clear that over 80% of research publications are still coming from the United States, although they're starting to decline over the past few years, not just because of the recent political events, but because of slightly declining investments in the US over the past few years. But it's actually striking that research outputs are increasing exponentially, and I mean exponentially, from China. And just last week, I was on a call with the Society for Neuroscience Advocacy Committee in the US, and they are obviously in a state of alarm about the current political situation in the USA. They're worried about the USA losing its leadership position in neuroscience, which it has held for the past 50 or 60 years, but they are not worried about losing it to Europe. They are worried about losing it to China. Europe did not come up in the conversation. And I think this is a choice that we are making and continue to make. And I think, just stepping out more broadly, the issue here goes beyond health. The reason the US has been a predominant power in research for the past 70 years is not because of their focus on Alzheimer's or Parkinson's, which actually really took off in the 1970s. It's because success in science for them, competitiveness in science, was synonymous with their defense capacity and with maintaining their place in the world. And just to echo something that Donald Tusk said a few days ago, I won't say exactly what he said, but he was referring to the current political situation in Europe. But I think I'll just paraphrase that for a second, and I'll ask everyone here, why are 500 million Europeans expecting 300 million Americans to pay for 80% of the world's brain research bill, which they've been doing for the past 50 years? There are reasons why this is also bad for us, why the status quo was bad for us. The economic returns primarily go to the USA. In 2023, the USA NIH alone spent $45 billion on pure discovery research. The same year, it was estimated that that year they made $90 billion back based on discoveries that came from NIH-funded grants. We're not seeing those returns in Europe. We're also seeing a very significant loss of what I would call hard brain capital, which means people with brains moving on airplanes to the USA and not coming back. And I'm getting increasingly tired of my best students moving to the USA and then not returning to Europe. And we're seeing increasing US domination of the next generation of artificial intelligence. And the next generation of artificial intelligence will be based on neuroscience. So this is what I mean when we're not just talking about health, we're talking about defense, we're talking about AI, we're even talking about bioweapons quite directly. Now, the issue is not funding. The issue is clearly not funding. We have the capital in Europe to be doing this. The issue is a lack of will or trust or understanding of the scientific story. So I echo what was said about we need to engage with the media more and we need to explain the story of science much more in Europe from the competitiveness perspective. And I can use Ireland as an example of this. We have a huge budget surplus since the pandemic. We have many tens of billions that we simply don't know what to do with because we don't have the infrastructure to put that money into. And we fund research in Ireland, depending on how you look at it, at Slovakian levels or at Italian levels, both of which are significantly below the European average. And despite the best efforts of myself and my colleagues, politicians just don't seem to understand why they should be spending, which is now a rather nominal amount on research to make the country competitive, because they either don't understand the story we're telling them, or they think it's too good to be true, or they lose attention because we don't maintain consistency in how we communicate the message. And this is why I think we need coalition. And while I think the Brain Health Partnership is excellent because it is catalytic as a focus with a lighthouse on neuroscience, on the brain as a theme, which I think is so important, we need to form a coherent message with our partners in other areas of biomedical research, not just neuroscience, and including organizations such as the League of European Research Universities and so on, where we can have a very simple and consistent message that will bring the financial investment in research, in brain research, to a competitive level. And we know that's never going to happen through these specific catalytic projects. It's only going to happen by increasing the overall funding level, which means following what the Draghi report and the Haida report are recommending and or alluding to, which means making sure the FP10 budget is getting to about 220 billion euro. And as an absolutely essential component is doubling the European Research Council budget, at least doubling it. Because without that, we cannot ensure competitive research in all of biology, but certainly in neuroscience. And coalition goes not just across organizations, but I think across member states. And I can say this again as someone from Ireland, is that one of the great things about the European Union is the indirect peer pressure that we can have. Once one or two countries start taking something seriously, other people want to copy, want to learn from them, and want to compete with them. And that's where I think competitiveness needs to be the focus of this conversation.
Thank you very much, Thomas. That was really a strong message, and I'm glad that you took the example of Ireland resonating in the EU rather than in the Six Nations. But thanks about that. And the panel was not meant to be about geopolitics, but I hope Jan and Agnese, you can live up to that. So Agnese, I would like to turn to you first.
Thank you, and thanks a lot actually for even sizing the burden of brain conditions as we heard, and obviously from my side being Chief Medical Officer at Angelini Pharma, which is a company not with a very long history in neurological disturbances, but with a strong legacy in mental health. We feel privileged being at this table today. So for sure, we heard a lot in between the lines, or very openly, the lack of resources we are experiencing in Europe. And obviously, when you think that maybe less than 10% of resources being allocated, investments to biomedical research are indeed in brain condition research, that's versus 40% of the European population being affected of these disturbances, it's quite relevant, the discrepancy. When, thinking of what we could also discuss quite concretely at this table, I think there is one piece probably which obviously has to do with the focus on regulatory. So I'm not sure at the moment in Europe we can say that we have a regulatory normatives and approach which has a strong focus on brain conditions. And I'm happy to hear about, the challenge on, the statistical probably being meaningful or not from a statistical perspective, but probably not from a clinical one. And that's one of the issues. So we currently know that beyond the investments on research, you then also need to comply with some guidelines which might need to be updated in order to have a brain health perspective rather than a single disease perspective. We talked about some aspects related cross diseases within the brain health. And unfortunately, when we go into research to develop drugs, we are not that able to address these aspects across conditions. So this is a burden in a way we may want to address. Again, saying into research, I think that at the moment we are in a quite good shape, although for innovative technologies, artificial intelligence, we might not be there as US, but still probably looking into data generation with a different perspective might definitely help in optimizing the way we use the scarcest resources we have. So the use of artificial intelligence, the approach to clinical trials in a more innovative way could ultimately bring to a perspective which can optimize resources even from our side. As pharma companies, I think we have the duty to think to research for the purpose of reaching patients in need. So it's, and here I'm also happy to hear about the link between basic research and clinical research. I'm not sure that probably so far investments in so-called translational medicine or modeling or whatever we want to call have been necessarily under the attention of, in fact, investors or more in general resources allocation. And this is something that I feel in some therapeutic areas, particularly in brain conditions, might make the difference for future research and for making this research more efficient. The public-private, we heard a few examples, the private-public cooperation, I'm pretty much sure would make the difference. I think that, again, I don't feel that, I mean, it is quite unprecedented, probably in the post-COVID area, the common ground where we do work as institutions and obviously private companies. And so I guess that this is also something which should be capitalized and obviously advanced further, I guess, particularly at this table. I would have much more, but I think that I would repeat some very interesting aspects already raised.
Thank you, Agnese. And as I said, the idea here is to really open the conversation. Jan, I'd like to turn to you for your introductory statement and maybe questions or issues that you would like to open up to throw on the table.
So first of all, Frédéric, thank you very much, and also Mr. Veryga and Professor Bassetti to put together this fantastic group of people and organize the day. It's very inspiring, enriching. It's fantastic to see the momentum that had emerged from the seminal 2022 WHO paper. here we are now, 2025, and we heard from policymakers and academicians and medical people, and last but not least, now from an industry perspective, how to foster and continue on the brain health mission and collaborative. So I agree with everything you said. I had many points already scribbled down that you so much conveyed much better than I could have been, but maybe let me build on this a little bit. The competitiveness in Europe, I think, is also very much dependent on incentives, right? So why is there so much action and ambition and productivity in the US? Because there is great incentives. There is much less bureaucracy, and you can implement and execute and experiment much easier than in Europe. I think that's a lesson learned from the US. We have all the means, we have all the brains. All the students that leaving to the US, they would rather stay here if there would be the same possibilities. So if we really create a frame where innovation is encouraged in the way that US does it very pragmatically, I think we can do something in Europe and overcome the pettiness and the fragmentation. And it's more complex, Europe. I mean, that's part of the beauty. We have a lot of national activities. But we are so fragmented that we don't yet have, and glad to hear, Frédéric, that 2026 there might be a European-wide big initiative, like not a moonshot, but a Mars shot. Like we had the Human Brain Project, right? But we need something much bigger than this. We only heard once today about AI. I mean, this is common daily knowledge already if you have discussions like this in the US. And I think we need to really think in a very, in a mentality of abundance going forward and not so much of scarcity. In Europe, we're very good at naming problems. And that's where we spend all our brain energy. And then it's done. And then we go and have a good time. It's very nice. But we need to go beyond this and really leverage the creativity that we have. And in that regard, I think Mara from Spain, you mentioned data sharing. There's huge power in this. We try to do this in the industry a lot. So there's three major obstacles. Technical standards. Everybody collects data in a different way. But we can maybe overcome this. Just to do a national registry is brutally hard. Much more difficult in Europe is then data privacy. Okay. We maybe find ways, which maybe in Canada is not so much a challenge, what I heard today. In the US, it's not even a topic. But the third one is academic mindset. It's like, oh, I have my 200 subjects, but it's my biomarkers. I need to publish myself and so on. So, but one way to maybe foster this, and I think it is incredibly powerful, that's something we are pioneering and other consortia are pioneering, are federated data approaches. So to use machine learning and AI, so it's basically the algorithms crawl into the various databases and extract the data needed to answer the big questions. So I think if that's something we adopt centrally and foster, we will overcome many of the barriers that we have created, and they're like dead ends, super hard to overcome. And yes, with that, maybe to leave you a little bit with a question on my side. So incentives, and I think you mentioned it, I mean, the whole pharma business depends really on the US. And we have a lot of activities in low and middle income countries, and we focus a lot at the end on the high income countries, but there's the one big one. And we don't know how it's going to continue, if they're self-dismantling or transforming, but we have a huge opportunity. So just a question, any guesses from anyone to bring a new medicine into the market? What's the investment, the average investment the drug company would have to do? Any guesses? Not the colleagues from industry. Thomas, would you have what would you say? If you would have the Rhine Pharmaceuticals, what would you have to invest?
Unfortunately, I'm just discovering neuroscience. That's one of my colleagues who works in the area.
For one drug? No, we're not that bad. So it's 5 billion in average. You have to invest at risk to bring a new medicine into market. And neuroscience is notoriously difficult because it's so complicated to have transformative innovation. And once you bring a new medicine to the market, you have an average maybe 8 years to make your money back, and then it's patent loss, that's a biosimilar or so on. So it is not an easy business to drive this forward, but it's a very important one. We have to know how to do data. We have to know how to do clinical studies, and we are very happy to share and build coalitions and collaborations. Big believer in public-private partnerships, absolutely. But we definitely have to keep in mind that the incentive structure in Europe has to evolve. Otherwise, people will continue to leave and focus on the US only, which is important too, but it's a fraction of the population worldwide. So, and that's a really worldwide problem that we have to tackle. So I leave it here. Happy to discuss more, but it's a great journey. Thank you.
Thanks a lot, Jan. And Agnese, I know you wanted to react.
Yeah, I just, no, thanks a lot, because I think I have two comments to build on your perspective. So let me share our experience. So Angelini Pharma is a company who's working a lot in terms of building our pipeline with the opportunity to look into external innovation. Therefore, often we are working with our BD colleagues in exploring opportunities. And I can tell you that most of the time what happens is that these opportunities are coming from US. Coming from US, most of the time the development started with quite a US focus. Therefore, although it's meant to be a global development, most of the time we are in a situation in which we need to start a negotiation and conversation process with EMA, which might be quite difficult. And so that's a very, in my opinion, that's a very good point to also consider at this table. And with regards to the data, I think another experience I want to share has to do with secondary use of data. So we know that in other areas in US and probably very linked to data privacy in Europe, but that's much easier, and it enables an amount of enrichment in terms of data analysis, which sometimes we can't afford in Europe because we are stuck in this data we can't use, which may make sense to some extent, but it's definitely a limit on this data perspective you mentioned. Thanks, Jan.
Thank you, Agnese. And I'll use my authoritative rights to have one question, and the privileged person is Alfred on my right, who was asking. So, and then we'll have to conclude. Over to you, Alfred.
Thank you very much for democratic autocracy. I would like to ask a question. You mentioned AI and data science, and our organization, Brain Research Africa Initiative, started an initiative last year. We call it the African Initiative for Bioinformatics Training for Neurodegenerative Diseases. What we basically do is we launch an application for African young scientists to be trained online, because that's accessible on computer language and all of that, to be able to use data, available databases, to ask new questions and do all of that. This is an opportunity in Africa, talking about coalition and competitiveness. I think that if Europe looks down to Africa for building brain capacity, we have young Africans who are just so passionate about computer science, and they really just want to learn, and they have great ideas and great capacities. It will be a low-cost investment, but maybe high yield for that population. We have already trained 40. We have the second cohort that is going on. That will be an opportunity for collaboration north-south. And then coming back to Thomas, thank you. Another thing that FENS and European Union organizations, they usually give opportunities for Northern African countries to be part of that. But Sub-Saharan Africa is usually kept out. Again, in terms of coalition, collaboration, and increasing competitiveness, we know what we're talking about. Looking back or looking at Africa can be a great opportunity to increase the strength of the conversations we're having here.
Thank you, Alfred. So I'll maybe invite you to respond quickly and with a word of conclusion. And I don't know who wants to kickstart. Jan?
Yeah, so when I was listening and reflecting, so what's the last big thing Europe is really known for at Europe in science? It's probably in nuclear physics, the CERN in Genf, in Geneva. But if you think it could be a CERN in neurology, if you said Centre Européen de Recherche Neuronale, and it's not nuclear, or we can call it CERC. So that's maybe a name for the big project. That's all I have to say. Yeah.
Okay. We'll put it in the action points of these meetings. Thank you, Jan. Agnese, you wanted to react?
No,
or
just
conclude?
thanks for the input, because I guess it's a very good one, expanding this mindset we might consider. Thank you so much.
Thank you. Thomas, a word of conclusion?
Just to say, I think one of the reasons that we have been successful in Europe in science has been because of the young people here. And I think expanding that is, including outside of Europe, I think is the key. I think having a CERN for neurology is a wonderful idea, but I also think that one thing we're missing is the hard infrastructure of a general biology, biomedical research environment in Europe. The US has their NIH is anchored at a physical NIH campus in Bethesda. And I think we should be looking towards the European Research Council or a similar body creating more centralized, stable, and predictably funded research institutes, because the European environment really does engender creativity, but not stability in research.
Okay, Jan, you're stretching it, but okay, 30 seconds.
Just to this point, maybe not to forget, we should continue to collaborate with the European Investment Bank, because I don't think it's a lack of funding, it's a lack of ideas and doing it. And we can do this. And that's where we have to get to Europe.
Well, thanks. And very valid point. And with all the great ideas that you all collectively came up with, I think we have enough to present a bill to the EIB. Thank you. So I'd like maybe to turn now to, well, thank you to our panelists. I'd like to turn to now our concluding panel and welcome Professor Elena Moro, the President of the European Academy of Neurology, as well as MEP Tomislav Sokol from the EPP group and from Croatia. We were meant to have a fireside chat on the question of a coordination plan. But before doing so, Elena, I wanted to maybe invite you to reflect on what you heard so far, because when we talk about the coordination plan, it means many things, but it basically means coordinating different initiatives and combining different ideas. That's at least the vision that we presented at the DG Santé workshop in November last year. So the plan for a plan, in a sense, but that was building on a brain health partnership, that was building on the effort at the national level, that was building on the vision as expressed by Alfred earlier on with the Yaoundé Declaration, but also all the examples and the topical elements that were mentioned this afternoon. So what would be your vision for a coordination plan, and what should it contain or prioritize?
That's not easy. That's not easy. First of all, Thomas, I want to say
Train who escaped Europe to go to North America 20 years ago, but I came back. So I was in Canada. For 10 years. So, Fred, that is a very difficult summary that you gave me. I think that after what we heard from this very rich discussion, it comes to me that we have in Europe a European capital of brain diversity. That is our really a treasure. And what I heard, we need the courage as European, as a citizen, to invest, right? So these are, I think, the key, to be ambitious,
and to have a lot of courage today to all the things that we said, they are implemented in Europe. You lost some of the discussion, Dr. Sokol, but what we said is that we are European citizens, and if we want to stay in this Europe and we want to thrive in this Europe, we need to invest in the brain, because the brain is the one that at the end allows us to be here today and to discuss today. So what has been said, I think that as we discuss, is that we needed to collaborate, we needed to work together. And to do so, I think there are some barriers that have been discussed, that we need to share the brain health plan, but in the positive way and in the difficulties that we have encountered during the journey. And for this, we need the European Parliament to help us, right? Otherwise, you know, I know what maybe I know what they're doing in France, where I work, but I think we need really to share all difficulties that you said about Spain. We heard about Poland. And the other, I think, a very important thing is that we can't just talk to the Ministry of Health. It's not enough. We have education. And so in the children, we have to go in the kindergarten and explain to them, explain to the teacher how not only to be vaccinated, but to protect the brain since the beginning. So we need the Ministry of Education, Ministry of Research, Ministry of Technologies, Ministry of Industries, otherwise an economy. So it's not only the Ministry of Health, it's the whole system that have to be changed. And if we don't do it now, we lose this opportunity. We have to start now. So it's not only the Ministry of Health, it's really everybody is on the brain ship. So we have to work on this. And the other thing that I think Europe is doing, and we really need to implement that. So we have all the phone, everybody has a phone, right? We are tracked. So it's not true that our data are protected. It's not true. So why we are so scared about, you know, some data, health care data, if they can really help the community? The hospitals, I'm working in a university hospital, and they are ready to share with the government the data. And I think everybody would be happy to share their data if for the whole community wellness. What's the problem? What's the problem to share biology, some other data? If it's for us, it's for our children. It's not for, you know, I don't know, some other person in the universe. So we have to be realistic. We have to be positive and really visionary for the future. So sharing data is one thing. The surveillance of the population, the prevention, the acute care, and the rehabilitation that we talk about. And maybe why we are scared, we are starting the screening of cancer, breast cancer, gut cancer, prostate cancer. Why we don't start to screen in the brain since the beginning? Why only vaccination and cancer? Why we don't work with the cardiologist and the oncologist? We're saying that we are sharing something together. The diabetes is a risk of several neurological disorders. Why we don't work even with the others? Why just only neurologists, psychiatrists?
Thank you, Elena. So I think you gave a lot of food for thought to your neighbor, who is supposed to wrap up later on with a lot of action points. But yeah, Tomislav, you have been a champion of people living with a brain disorder since a couple of years, a friend of EBC since a couple of years. You have been supportive of many of our proposals. But how about this idea of an EU coordination plan for the brain? And how do you see it happening if it could happen?
Thank you very much. First, I have to thank you for inviting me again, but also to apologize for not being able to be from the start, because a lot of things going on now on health today in the Parliament, which is a good thing. So it shows that we are doing something, that we are maintaining the momentum, that these things are being discussed. I think that's very important. So on some of the things that were mentioned, but let's first start from the momentum. I think that the crucial thing is that we retain healthcare as one of the policy priorities in the EU, because I often say that before 2019 it was a completely marginal topic. That has changed with the COVID-19, but also with Europe's Beating Cancer Plan, because that actually showed that there is a political will. We can do something on health, and something concrete, not just a wish list, but concrete strategy with concrete objectives, concrete measures, concrete benchmarks, and concrete funding. Pretty strong funding in that example. So I think that definitely that this has shown us the path, what needs to be done and what can be done. Of course, when you speak about priorities, some things have been mentioned. So EHDS, I think that's very important. We speak now a lot about research, about innovation, about competitiveness, and now these are the priorities in the European Union, and definitely EHDS and the question of secondary use that was mentioned fits in there very well. And you can't imagine what kind of obstacles we had to face when we were discussing and negotiating secondary use, because a lot of people thought that this should be extremely limited, that only public sector, public research should be involved, even though obviously to develop new medicines we need private sector as well, that we should have an opt-in or a consent-based system. So because they were afraid of privacy issues, etc., etc. Also, there were some people who said that we will make it possible for big tech companies to take away our data and use it for social media profiling or whatever. So there were different things, different ideas floating around, but fortunately we were able to prevent most of those craziest ones from coming to fruition. Because with the secondary use, obviously, if we accepted an opt-in, we have enough data that shows us that then the whole system would have become useless, because we will be able to get representative data. Even with an opt-out, that can be a problem, but with an opt-in, definitely the whole secondary use of data would just not work. So being able to have the HDS adopted on time, being able to have secondary use, being able to have it as a harmonized solution, so that not every member state have its own regulation, which member states wanted. That was the biggest point of contention, because member states said, "Yeah, but we want to regulate this by ourselves, to have the discretion that we could diverge from the European regulation whenever we want, essentially." So that the whole thing was kind of balancing there, whether it will succeed or not. And in the end, we were able to find a compromise that we have a harmonized solution for secondary use, but in extreme cases, then exceptional circumstances like public health crisis, etc., member states can bypass some of the restrictions, etc., but very, very limited circumstances. We also had to explain to people that nobody will be able to take away their data and use it for something else, so that this is why we prescribed clear purposes for which data can be used, so only public interest. We also made clear that data must not be used to re-identify patients, so it has to be anonymized or pseudonymized, that it can only be accessed in a secure environment, that nobody will be able to download it, take it with them, etc. So that was an important exercise, but I think for us, if we want to really unlock all the potential of data for research, and I think for brain health, this is extremely important, maybe most important. I think that's one of the areas where we have the biggest unused potential for research. Definitely, these were the crucial things to make the whole thing work. Of course, what is now the main elephant in the room is money. And to be honest, some information that is being floated around about the idea that we put the whole fund, the whole EU budget into one pot, and then just have Commission and the member states essentially negotiating between themselves, definitely is not a good idea. So if one thing that Draghi report shows us, and the whole competitiveness issue shows us, is that we need programs with clear European dimension, so clear European added value. So not just giving away not just not giving away, but giving money to the member states to use, but actually have common European things, common European actions, common European policies where we create added value at European level, where we resolve problems which member states cannot resolve by themselves. And I think healthcare is one of the key areas there. So for us, it will be crucial that we protect health budget, separate health program in the budget to even increase it, but not to avoid that healthcare is put in one pot when it will be diluted to other purposes. Then if this happens, then in the long term we lose health as EU policy completely. So this will be a big fight in terms of big investments. Definitely EHDS, implementation of EHDS. So we have to prepare the infrastructure. We have to prepare the people, health professionals, patients, etc., so that they know what this is about when the whole thing starts, and it will fully start in 4 to 6 years. So this is why we need concrete funding. Also, we need funding for research. One of the things that are being floated around also is that Horizon completely is taken by the competitiveness fund, which would essentially mean that it will be spent probably for some projects directly related to the economy, which is not a bad thing, but we also think that we need basic research as well. Without basic research, we cannot do applied research, and it's good to have this kind of a merit-based, excellence-based system like we have in Horizon, of control, of having researchers evaluating research projects. So I think that this is something that should be kept. Of course, to be honest, there are a lot of things which are being funded in the academic community, because I come from an academic community, not from STEM. I'm a lawyer, but still, a lot of projects which are art pour l'art, which are just there for somebody's vanity, etc. So maybe these things should be controlled better. But definitely, the fact that some things can be improved in Horizon does not mean that we should essentially abolish it and just give money to apply research, to concrete funding for companies or whatever. So I think that it's important that we protect independent research, basic research, fundamental research, also to make sure that our universities take part in this, and then see how we can scale up, how we can connect this with the economy, etc. So I think that we first have to protect research funding as such, research program, and then also give more importance to brain research there. I'm sorry that we were not able to create an intergroup on brain health. It wasn't, I have to say now, I have to defend myself, it wasn't our fault, because in DPP, my political group, we were able to get it through, so DPP supported this, but unfortunately some other political groups, some colleagues could not get support from the other political groups for this intergroup, unfortunately. So we did our part in DPP, but unfortunately the other groups didn't support this, but there are other ways how to work. There are other ways how to advocate for important things, and I think brain health should definitely be one of the priorities. I've been saying all along, so after cardiovascular strategy, which is now the first priority, that's already been decided, the next two should be rare diseases and brain health. So these two should be the priorities after that. Of course, the starting point, the basis should be that we get health funding which could actually finance this, because obviously if you don't have funding, then there is no point of having a strategy, just a wish list. So we need to have a clear funding. So there definitely these are the first steps that we need to take. So in order have an EU health budget, have a strong health budget, stronger than now, have a strong research program, Horizon or whatever the name will be, FP10 or whatever, and then to use this as a basis to create a real brain health strategy with clear measures, clear funding, clear benchmarks, clear objectives, and everything that goes with it. So it will not be easy. As I said, now in the current plan of the Commission, it's only cardiovascular, but I think after that, in the area of rare diseases and brain health, EU can provide the biggest added value. And that's my deep belief, and definitely I will continue to fight for that.
Elena, any comment on what we just heard from Tomislav?
I say thank you very much. I also want to say that brain diseases do not have borders. Right? So we are in the same ship, as I said before. And I would like also to ask if in this coordination plan, there is it was raised before, a way to reduce all the administration, the long delay that we have to start clinical trials. Because no, it's really, Europe is becoming really outside all the clinical trials international. We are the last one. So is any plan also to synchronize in the European community at least facilitate clinical trials? Because that is a problem.
Yeah, so this is a topic in the parliament that we are raising. We don't have any kind of feedback from the commission so far, so it's not in their plan now, but their plan is only for the next year or so, and then we'll see what happens. We'll put pressure on them. I think there are some things that can be done, and there are things which will be a bit harder to do. I think when you speak about ethics criteria and ethics bodies, here our possibilities are limited, because there you have the intertwining between the national competence and European competence, and to be honest, I don't see member states being willing to actually give EU possibilities to harmonize this. To be perfectly honest, so ethical considerations and conditions, etc. There are other ways how we can stimulate cross-border clinical trials. I think one of the things is definitely the revision of the cross-border rules. So that's one of the topics that we are also raising. It also will not be easy, but for instance, possibilities for patients to access to have specific provisions to access cross-border clinical trials will be very important, because now under cross-border rules, if you want to access treatment abroad, it needs to be treatment that the situation that you don't get adequate treatment at home, but needs to be standard treatment. So experimental treatment, including clinical trials, is completely excluded. And that's a problem. So then we don't have a legal basis for patients for coming from smaller member states to bigger member states. For instance, if clinical trial is only conducted in big member states, that we send patients from smaller member states there. So that's a problem. So we'll fight for that, for this revision, but it will also not be easy. But I agree that the clinical trials regulation is something that needs to be looked at, that needs to be reviewed. There are things that can be simplified, but the obstacles there, I think, will be pretty big, because member states will not want to touch a lot of these things, unfortunately, because usually it is the question of the member states, so and their competence. And I don't know if our colleagues from the ECR think that we can do something on that, because I know that ECR is the group that's always very attentive on the competences of the member states. But I think in the area of health, we have to see what can be improved, and that we need some common European solutions. But on the ethical questions, there it will be very hard. And I think that a lot of these things are pretty controversial. And I think it will be pretty hard to have a kind of European harmonization there. But we'll see. But definitely in the parliament we are discussing this a lot, and now we'll have to put pressure on the Commission to also do something with it.
Thank you very much, Tomislav. And we know you are also on the time pressure with other commitments. So we'll probably, and we are running late anyway. It has been a very long afternoon. So it's now with pleasure that I relinquish the moderation of these sessions to you, Claudio, for a word of conclusion, and to our host, MEP Veryga.
Well, thank you. I will be very brief, and it is impossible to summarize such a day. Just let me thank all the speakers, all those that attended, and in particular, the two MEP for being with us today. Your presence just proves how important brain disorders, brain research, brain health is to you, and we hope that based on what you said, we'll be facing a brain healthy society soon. I would like to ask you all to thank also EBC for putting together this fantastic memorable day, and please join me with a short clap. Now, as I said, I will not try to summarize, but I just wrote down a few statements which you may remember with me, or just short notes on what has been said. The first statement was by MEP Aurelijus Veryga, who is himself a psychiatrist. I was impressed by the fact that you acknowledged so eloquently the importance of brain disorders based also on the current crisis, COVID-19 and the wars. And your strong statement was you cannot separate neurological and mental disorder. We need to address them together. Tarundua was not with us from the WHO, but she made a very strong statement which goes a little bit in the same direction. Brain health is a determinant of mental health across the life course. We should not separate them. Jenny Young, we cannot silo single brain disorders. We need to work together. And I think this is one challenge. If you do research, we have to go into very concrete silos. We cannot do brain research on everything. But when it comes to such initiatives, we need to have, I would say, a double identity, a double soul, one which is overarching and the other one which is actually fostering mechanistic approaches and therefore also silos. In my statement, I used one article that we have recently published as a slogan: one brain, one mind, one life, one health, one planet. Brain health is important for the entire health of a person. It's important for our lives. We have only one brain, one life, but it's important also for our society and for the entire planet. We need to think beyond the brain and in a more global approach. Christopher Chen, I like your statement. We have no national resources, but we have the brains of our people. So we should take care of this statement. Henrik Pearson from Norway. I was impressed by one single statement, or I should say one sentence you used. 78 associations speaking with one voice. This is really what we need. And I think you also stressed the fact we should not look at what separates us, but we need to see what we can do together and what we share, and not only why we are different. Alfred Nyamshi from Cameroon. Well, some new funding schemes you raised, and you spoke about the absence of philanthropy in Africa. We have to learn from other countries. Sometimes I like to say there is much philanthropy where there is some guilt to pay back. But I think you used the term neurodiplomacy, so I think we need to learn how to work on that. The Spanish duo spoke about the Spanish brain plan, which will be presented on May 28th. So we are very keen to listen to more details. But I think there is one word that I think Elvira used. I think that one thing that we should understand is that brain health is not only about prevention, but it's also about promoting the care of chronic brain disorder people. And I think chronic disorder should not be forgotten, the same for rare disorders. Then we come to Poland. I think I was very impressed by the fact that you substantiated your intervention with different numbers, which were quite impressive. And I was very impressed also by the lack of knowledge on brain health and mental health, the awareness that is so present at this table is still a challenge in the population. And I think we should learn from these kind of activities to put them forward also in other countries. And for the first time during the day, AI-assisted diagnosis and health was put forward. And I think this is indeed the point that also the MEP at the end was stressing. I come to Finland, and I need to say that I share your approach, primordial prevention approaches using sleep, good sleep, but also your statement, it's not only about funding, it's about thinking in a smart way how to promote things. And I think this is very important. Coming back to Henrik Pearson, I liked the general approach of trying to do things together, for example, looking at diagnostic delays across disorders, so we should not silos the different disorders. Well, very strong statement from Morten Lorentzen. I like two statements. I give you two statements, so to say. Politicians believe in numbers, and I think they are right. They need to see the evidence, and when we develop national plans, we need to have local data to frame them in the local needs and gaps. And I completely share your second statement. Slow-moving tsunami. We need to look into the needs of young generation. I think this is incredibly important. I come to the Lighthouse project, and I think here the statement was very important. We need to look at evidence-based solutions, and we need to address real health challenges. So again, the need of looking at concrete data from the single countries. Thomas Ryan, a very eloquent statement. There is at the end and at the beginning competitiveness, and I think we need to also develop coherent messages, and I think you address also the importance of the lack of understanding of many policymakers, and we need to work on that. Agnese, translational research, this is something which one could state lost in translation. I think translational research is underfunded and understood. Jan, many strong statements. I think I like the statement on, well, one statement was a little bit hard. We are good in making problems. We need to go beyond that. But I think we need federated data approaches, and this has become a little bit a common theme in the second part of the day. Elena Moro, great capital in Europe in brain diversity and not only in brain problems. And MEP Tomislav Sokol at the end, you gave us some hopes. Next priorities, cardiovascular. We know that diabetes, cardiovascular, diabetes, and cancer. But we need to hope that rare disorder and brain disorders will come on the agenda. So this was not a summary. These were just flashes of what I have heard. I was really impressed by a day, for me, memorable day. And thank you again for being with us today. And I would like to hand over to Aurelius.
Okay. Thank you, Professor Bassetti, and that was a very enriching day, and it was such a luxury to be with so many experts in one place and listen to you. And I think that we have to use the momentum. I've said that on several occasions when we had the discussions about health at the European Parliament, because you now, of course, you know that Europe is struggling with many problems, and the defense is a big issue, and competitiveness is a big issue. But what I say is that this is a window of opportunity also for all of us, because health is also about competitiveness, and health is about also the defense and security. And I've mentioned in the short video to your colleagues that in my own country, half of the youngsters are not suitable for military service because they have health issues. And big part of this is a brain health issues. So this is about security, and this is about defense. So we have to use the momentum, and we have to communicate with the politicians, because as it was correctly mentioned, most of the politicians do not come from the health sector. Most of them do not know what you know. So it is a challenge to translate, into the political language, all the things that are important to be done. And sometimes you don't need to convince everyone. Tomislav is an ambassador in EPP. You have now new ambassador in ECR. So it's not about the political groups. It's about, very few people being there and just telling, what has to be told, because it's not given that everyone knows everything. I've learned many things today, even being from the area myself. So thank you for all of this. And this parliament is just started to gain the speed, and I think we can have a success in this job, and especially having in mind that many things are upcoming, and the budget and all other discussions are upcoming. So let's work together, and I would like to thank all of you, the Professor Bassetti and all the European Brain Council team for organizing this event, and all the presenters for the presentations. And also I want to thank Ernesta, my assistant, who helped to arrange all the technical things and issues. I don't know where she's. She's here. So thank you, Ernesta, and thanks to all of you. And let's work together.
Thank you.